Good morning, everyone. I am Montgomery County Council President Gabe Albornoz, and welcome to our full County Council agenda today on Tuesday, September 13th. We will begin today's agenda with an important proclamation recognizing Infant Mortality Awareness Month by Councilmember Friedson. Would everybody who is here for that proclamation please come forward?
Good morning. Welcome back. We are here today for National Infant Mortality Awareness Month, and we are joined by Pat Keating, the Fetal and Infant Mortality Review Community Action Team co-chair, who will speak after our proclamation. We have Jade Ann Rennie, the Fetal and Infant Mortality Review Board co-chair as well. She'll speak as well, and then we're also joined today by Dr. Carol Garvey, and Becky Smith. So thank you for joining us today, for being part of this, and Sheila O'Connor as well. The U.S. infant mortality rate is 84% higher than the average of comparable countries, and the rate is not improving here at a similar rate to those other countries. Among those startling statistics, there are significant racial disparities in infant mortality rates in the United States. Black people experience the highest infant mortality rate among all racial and ethnic groups, as well as the highest rates of preterm birth, low birth weight, both of which are the leading causes of infant death. Black women, in fact, are 3 times more likely to have a low birth weight baby. Pregnant people who are American Indian or Alaska Native and Native Hawaiian or other Pacific Islander also experience a higher than average infant mortality rate. The infant mortality rate among Hispanic mothers is like the national average, while rates among white and Asian mothers are lower than the average. Structural racism is a primary risk factor for African American mothers and their infants, largely due to complex stress it places on mothers throughout their life. Black women who report high levels of racial discrimination are 3 times more likely to give birth prematurely and 5 times more likely to have a low birth weight baby. And you'll probably hear from our experts, of which I'm not, but racism causes stress, and that causes cortisol. And pregnant people who already have elevated cortisol levels contribute to an excess of cortisol that reduces blood flow to fetuses and causes a myriad of health issues. Well, we're here to raise awareness about fetal infant mortality. Maternal morbidity is a related and equally consequential issue in need of our attention. According to Montgomery County Improved Pregnancy Outcomes Program, Fetal and Infant Mortality Review Board Community Action Team Fiscal Year 2020 Annual Report, while maternal mortality was very low, severe maternal morbidity was higher here than the national average. Black, African American, and Hispanic women were 61% and 46%, respectively, more likely to experience severe maternal morbidity than white women. So we're here to talk about these issues. We're here to raise awareness for these issues. We're here to promote awareness of the racial disparities that exacerbate these issues, to identify and address unconscious bias in healthcare here in Montgomery County and throughout the country, to encourage patient empowerment, and to encourage more BIPOC, particularly Black students, to join medical fields. Black newborns in hospital death rate was 1/3 lower when Black newborns were cared for by Black physicians rather than white physicians. So we're here to raise awareness. We're also here to express our gratitude to those who are in the field actually doing this work, who are partnering with county government, who are working in and volunteering with county government to really make a difference. And I'm just really appreciative and grateful for our guests who are here today. So I'm going to read this proclamation, then I'm going to turn it over to our guests to provide the expertise that I lack on these important issues. And I'm just very grateful that we're here today to lift up what is a critical issue in our community, affecting mothers, affecting pregnant people, and affecting our children. So we have a proclamation from the Montgomery County Council. Whereas, according to the most recent data available, the infant mortality rate in Montgomery County over the last 5 years was 3.8 deaths per 1,000 live births, which is lower than both the Maryland and U.S. rates. And whereas, despite this low rate of infant mortality in Montgomery County, disparities by race remain. Due to historical and social inequities, the rate is 6.2 per 1,000 live births for Black women in our community, which is double the rate for white and Hispanic pregnant people. Furthermore, Black women continue to experience more than 1/3 of all losses, despite accounting for less than 1/4 of all births, which starkly illustrates the disparity in outcomes. Whereas this disparity persists even among highly educated, higher income women, with approximately 100 annual cases of fetal and infant loss in Montgomery County that occur across all socioeconomic statuses. And whereas nearly half of all individuals in Montgomery County who experience a fetal or infant loss in recent years started their pregnancy with at least one risk factor, such as advanced maternal age, obesity, and chronic health conditions like hypertension and diabetes. Whereas, through the support of the Montgomery County Improved Pregnancy Outcomes Program, the Fetal and Infant Mortality Review Board and Community Action Team promotes awareness of racial disparities in infant mortality, improves healthcare systems, promotes patient empowerment and health education, supports the evidence-based practice of nurse case management to support pregnant people in at-risk groups, and examines social determinants of health and implied racial bias when assessing trends in infant and fetal loss. And whereas Montgomery County, in observance of National Infant Mortality Awareness Month, encourages all residents, medical providers, and other community partners to promote education about fetal and infant mortality and the persistent racial disparities in birth outcomes, and support healthcare system changes to address these issues and strengthen community resources. Now, therefore, be it resolved that the County Council of Montgomery County, Maryland hereby recognizes September as National Infant Mortality Awareness Month, presented today on this 13th day of September in 2022, signed by myself, Andrew Friedson, and Council President Gabe Albernas. Now I'm going to turn it over to the actual experts, and first we'll start with Pat Keating. Pat? I'm sorry.
Yeah, that's okay.
As I said, not an expert, as evidence. So we'll start with Jane Ann. Thanks.
Thank you. Thank you, Councilmember Friedson. Good morning, members of the County Council. Good morning, members of the Fetal Infant Mortality Review Board and friends. I am Jade Ann Rennie, Public Health Program Manager at the Collaboration Council and co-chair of the Fetal Infant Mortality and Review Board. I'd like to thank Councilmember Friedson for for this proclamation recognizing September as Infant Mortality Awareness Month. We appreciate your interest in highlighting birth outcomes and related racial disparities in Montgomery County. The FEMR board is charged with reviewing cases of fetal and infant loss and developing recommendations designed to improve birth outcomes in our community. In Montgomery County, we typically have between 90 to 100 fetal and infant deaths annually. And although they fluctuate from year to year, infant mortality rates in the county have declined in recent years. However, as the proclamation makes clear, Black African American women experience a disproportionate number of these tragic losses and have an infant mortality rate more than double that of white women. The FEMR board examines a wide range of factors that may have impacted the course of the pregnancy, including environmental factors and other social determinants of health. It then makes recommendations to the Community Action Team, which was created to carry out key initiatives. Every recommendation has the same goal: to support healthy pregnancies for all women in Montgomery County, thus ensuring that infants are given the best possible start. By increasing awareness of the prevalence of infant mortality in our community, we hope to build on current efforts and continue to identify solutions to these heartbreaking losses. Today's recognition goes a long way towards helping accomplish that goal, and we thank you for your support. I'll now turn it over to our FEMR Community Action Team co-chair, Pat Keating, who will now make a few comments.
Good morning, Councilmember Friedson, members of the County Council, and FEMR Board and Community Action Team members and supporters. I am Pat Keating, co-chair of the Montgomery County Community Action Team. I'm a registered nurse and recently retired as the manager of maternal and child community health education at Holy Cross Hospital. As Jade Ann noted, the Community Action Team works to improve healthcare systems and strengthen community resources by putting the key FEMR board recommendations into place on the ground. Our initiatives range from promoting good preconception health to ensuring that women are linked to a medical home throughout their childbearing years and receive early and regular prenatal and postpartum care. Our efforts frequently involve outreach to OBs and other medical providers, as well as direct outreach to women of childbearing age, especially women of color. We are able to make system improvements because of our dedicated healthcare providers, community agencies, and other public and private institutions who work together on the Community Action Team to improve pregnancy outcomes and address the persistent and alarming racial gap in infant mortality. Our team understands that community awareness of these issues is crucial and is the first step towards pushing for needed changes. We applaud the current spotlight on racial inequities in health and know that addressing this requires action at all levels, from decision makers in government and the private sector to individual women of childbearing age and their partners. Today's proclamation is a very welcome event and one for which we are grateful. We thank you for shining a light on infant mortality and proclaiming September as Infant Mortality Awareness Month.
Well, thank you so much. Clearly, there's a lot of great work being done in Montgomery County that we're very proud of and very grateful for, but a lot more work that needs to be done. We hope you'll join us in raising awareness for this important issue. We have a panel discussion coming up next month, so stay tuned for more information about that. And thank you so much for being part of this really important effort and helping raise awareness. We're going to take a picture now, and if colleagues want to join, please do so.
All right, good morning, and again, thank you all very much for that important presentation. And I believe we have at least two of our colleagues who will be joining us virtually this morning, and I'm not sure if they have logged in yet. Well, while we are waiting for that confirmation, we will move on to the general business. Madam Clerk, do we have any agenda changes or announcements?
Good morning, Council President, Council members. We have one agenda change to announce this morning. Item 4N, the introduction of resolution to approve Montgomery County Planning Board Regulation 25-22 on forest conservation trees. The T&E Committee work session is tentatively scheduled for October 17th, 2022. The Council received one petition from residents of Montgomery County supporting Bill 13-22 Buildings, Comprehensive Building Decarbonization, 200 names. Thank you.
Thank you very much, Madam Clerk. And there are no minutes for approval this week, and so we can move on to the next item on the agenda, which is the Council sitting as the Board of Health. I'd like to invite the members of the Department of Health and Human Services and Public Health team and MCPS to please come forward. And colleagues, we are on a tight time frame today, first day back, and so we will be instituting the 5-minute rule so that we can try and get through this morning's presentation and then on to the rest of the items on the agenda. All right, good morning again, thank you. And I'd like to take this opportunity to welcome Dr. Kapunen, who is the newly appointed School System Medical Officer for Montgomery County Public Schools. Dr. Kapunen, welcome. We were very excited to hear about the development of this critical position, and we have heard wonderful things about the immediate interaction and collaboration, which had always been there between MCPS and our Department of Health and Human Services, but this takes it to an even higher level. So welcome, Dr. Kapunen. Thank you so much for joining us today.
Thank you so much. I'm excited to be here today.
Absolutely. And with that, I'd like to ask that our colleagues and friends in the Department of Health and Human Services begin this morning's presentation by introducing themselves, and then we'll move on to our MCPS colleagues to introduce themselves. Dr. Kroll.
Good morning. I'm Dr. Raymond Kroll, the Director of the Department of Health and Human Services. Good to see you all.
Good morning. I'm Kimberly Townsend, Senior Administrator, Montgomery County DHHS, Communicable Disease and Epidemiology.
Good morning. Sean O'Donnell, Public Health Manager for Public Health Emergency Preparedness and Response.
And Earl Stoddard, Assistant Chief Administrative Officer, Office of the County Executive. Good morning.
Good morning, Brian Stockton, Chief of Staff of Montgomery County Public Schools.
Patricia Kapunen, School System Medical Officer, Montgomery County Public Schools.
Good morning, Stephanie Izzard, Executive Assistant to the Chief Medical Officer.
Wonderful. Just want to begin with some kudos. I had the opportunity last night to participate in the monkeypox town hall that was conducted in Spanish. This follows in a series of those presentations which have been incredibly informative and very helpful to our community. So again, want to thank you for your leadership in that regard. And I also want to make a note that on September 29th, the Health and Human Services and Government Operations Committee are having a joint committee session to discuss the status of the public health officer position and follow up on some conversations we had had prior to the recess to talk about where we are in that process. And so I would ask my colleagues to, if they can, in their 5 minutes, save those questions for that joint session because that will give us an opportunity to expand. So with that, we can go ahead and get started with the presentation.
Thank you very much. We'll begin with a few notes about COVID, and we'll move on to some updates on Mpox or monkeypox. The first thing I'd like to share with the council is the most recent news of a bivalent vaccine that's available now. This came out about 2 weeks ago. The county has received a small amount of this, although we're aware of a larger amount that's gone out around the county to private providers. The important thing to note here is this new vaccine offers protection not only against the ancestral version of COVID, but also the Omicron version of COVID. And we're hopeful that this will provide better protection as we go forward and see new variants. Additionally, this new vaccine, this new booster vaccine is now authorized for everyone to get another booster, as long as it's been 2 months since their previous booster shot. So that includes some of our more vulnerable, both older or immunocompromised individuals who may have already received 2 boosters. They can now get a third one. Or other individuals who have not qualified for a second booster can now get another one. So again, as long as it's been 2 months since the previous booster shot or since they completed their primary series, they're eligible for one of these boosters. As we mentioned, there's a number of different ways to find where the vaccine's available, either through the Maryland search engine, which this is showing all the locations in our area that have the bivalent booster, or through vaccines.gov. Largely these are pharmacies, urgent care. The county, again, does have some, and we've asked for more of this vaccine, although it's very clear the strategy is to get this out to as many providers as possible. Looking at where we are as far as transmissions, we've continued to see our transmission rates based on PCR testing come down. We are now at 120 cases per 200,000, and combined with our hospitalizations, that does put us in the low CDC community level. The hospitalizations have come down some and bounced around a little bit, but to give you a little bit deeper dive into it, we've seen significant decreases over the last week in our acute care beds as well as in the alternate care site. So we're happy that there appears to be lots of capacity within our healthcare system, and happy to see some of the more severe illness starting to decline. When we look at our death statistics, we have seen over the last few months, those have held fairly steady. Again, this is affecting some of the most vulnerable individuals and causing mortality. We're hoping to see a decline this month based on the reduction in transmissions. But again, this does appear to be affecting individuals with more serious underlying conditions. One of the updates that we'd like to share, I know we've shared in the past, the different risk levels for both hospitalizations and deaths related to the vaccination status of our residents. So this is Montgomery County data, and we've seen significant higher risk for hospitalizations between vaccinated and unvaccinated, and again, a higher risk for deaths, vaccinated, unvaccinated, and boosters. We haven't had data locally on the booster levels and the impact to hospitalizations. However, 2 days ago, the CDC published a study in JAMA, and that shows pretty clearly that compared to those individuals who are boosted, those who are unvaccinated are 10.5 times more likely to be hospitalized. And those who are just received their primary series are 2.5 times more likely to be hospitalized than those with boosters. So while those initial vaccinations do provide a very significant amount of ongoing protection, that protection does wane over time, and the boosters are very important. Additionally, of those who are being hospitalized, we see a very different type of person who's ending up hospitalized who's vaccinated. They tend to be much older and have more underlying conditions than those who are unvaccinated. We also wanted to share an update on our pediatric vaccinations. On the bottom, you can see our 5 to 11 vaccinations, which have been going on for about 10 months now. And we are at 67,000 children who've had at least one dose within this age group. At the top, you can see the under 5 vaccinations, which started a little bit earlier this summer, and we are now at 13,000 vaccinations for that group. Notably, that's about 20% of this age group. So there's still a lot of parents who haven't had their children vaccinated yet. I do realize we see the least number or the fewest or the lowest rate of severe illness in this age group, but we are still recommending vaccinations for this age group because we don't yet know what the long-term impacts of COVID are. Again, that 20% within our county is about double what the state rate is. At this time, I'd like to turn it over to Ms. Kimberly Townsend to talk a little bit about MPX.
Thank you, Sean. So this is just a snapshot of MPX case trends reported to the CDC. You can see that it started to peak in mid to late August, and we're starting to see trended downward. So that's really, we're encouraged by that. Here is our CDC US case map. You can see that the cases in the United States are now at 21,894 cases, and this was updated on September 9th. And currently in the state of Maryland, we have 571 cases of MPX. Since we last met, the Maryland Department of Health has created a data dashboard that's accessible on their website. And this dashboard includes jurisdictions that have 10 or more cases in their jurisdiction. You can see here that the majority of the cases of MPX in the state of Maryland are in either Prince George's or Baltimore City, and Montgomery County currently accounts for about 12% of the cases. To the right, you'll see that there's a breakdown in terms of gender. The majority of cases are among males, and they're between the ages of 20 and 39 years of age. In terms of race, the majority of the cases are noted to be, and this is again within the state, Black or African American, and in terms of ethnicity, non-Hispanic. This just shows the trends in terms of first and second doses. We started vaccinating with Jynneos vaccine in late June, and you can see where first doses peaked in early August, and it's coming time for most of those people that receive first doses to get their second doses. They're about a month apart, and so you can see this demonstrates that the amount of second doses have increased while first doses have decreased as well. And we've seen a waning interest of first doses. It's slowed down a little bit since we first started. In terms of our outbreak mitigation, just to review, there are 3 priority levels. We previously referred to them as phases. The priority 1 group are the traditional post-exposure prophylaxis group, and these are individuals that public health has identified as contacts of individuals with MPX and healthcare and lab staff that have been exposed. The second priority group, which is who we are currently vaccinating, are also those who have been exposed to MPX, but also those that self-identify as known and unknown case contacts. This also includes community members that have potential exposures within the last 14 days. And finally, the third priority group would be your preventive or pre-exposure prophylaxis group. And we're going to be planning for this, moving on to this priority group as vaccine supply evolves. So in terms of demographics in our county, you can see that, and this is from the initial 62 cases identified. In terms of gender, 96% of the cases in our county have been males. And the age groups, you can see that over half have been between the ages of 18 and 34. In terms of ethnicity, similar to the state data, the majority of the cases that we've seen have been in our Latin and Black African American communities. So far, we have vaccinated 1,222 individuals, and this includes first and second doses. And we have some data that we've collected from those that have come in to be vaccinated. And majority have been males, identifying as lesbian or gay. In terms of race, the majority are either white non-Hispanic or Hispanic and Latino. And the average age of those coming in for vaccination has been 39. So vaccination update. We've really been working hard to expand our capacity so that we can get the vaccine out to those at highest risk. We've scheduled 1,000 new appointments for this week. And on last week, we sent out appointments to the remaining individuals on the pre-registration list that are eligible for the post-exposure prophylaxis. So we're really pleased about that. As I mentioned earlier, the Maryland Department of Health also has a pre-registration link on their website. Some of our residents may choose to go to that website to pre-register. We just want to share with you that we are collaborating with Maryland Department of Health, and our staff has access to that pre-registration site so that we can cross-reference individuals that are waiting to get the vaccine. And also so that we can follow up with those that need follow-up. So we continue to work to identify additional at-risk individuals and expand our criteria in collaboration with the Maryland Department of Health. Happy to report that on September 1st, we received 500 additional vials of Jynneos vaccine, which is up to 2,500 additional doses. So we're very thankful for that. Just other updates, we have added some wraparound services to those clients that come in for MPX vaccinations. As some may know, at the Dennis Avenue site, we also provide COVID boosters and sexual health screening. And so when they come in, they can get that during their appointment or schedule for a future appointment. Since our last meeting, we have also updated our website with MPX information. Our pre-registration tool is available in several languages, and we also have a page that has information in Spanish. And as Council President mentioned earlier, last night we had our second MPX Town Hall for the Latino community, which was a great conversation. I think there was a lot of information and learning going on, so we're really pleased with the outcome of that. And that wraps up the update for MPS.
Great, thank you both. We'll turn it over to our colleagues in Montgomery County Public Schools.
Good morning. I bring greetings on behalf of Dr. McBeeford Rank. I'm Brian Stockton, the Chief of Staff here at Montgomery County Public Schools. At Montgomery County Public Schools, we are proud to reopen schools to 161,372 students and growing. I think by September 30th, that number will be close to 162. Also, I just want to kind of repeat Dr. McKnight's priority areas for this year. Priority area 1 is engaging our stakeholders in rebuilding trust. Priority area 2, organizing schools and workplaces for health and social emotional wellness. And priority area 3, focusing on equitable teaching and learning. As we're hearing, COVID is still amongst us, and we're committed to both safe and in-person learning. So I'm happy to reintroduce again Dr. Patricia Kapunen, our new school system medical officer, who will present an overview of COVID-19 strategies for our school.
Thank you, Mr. Stockton, and thank you, members of the County Council. Just to introduce myself in my role, the school system medical officer role is a new one, and here are some of the guiding principles as we figure out how my role can best support the school system and the community. First of all, it's to interpret the data science and guidance for school system leaders. We all know that the evolving data landscape and the new science can be difficult to interpret, so making sure that school leaders and the school community understand what's latest and what's happening in COVID is very important to us. And then through the lens of our school system community, making sure we design health and population strategies that implements this expert guidance and the regulatory directives we get from multiple levels. And then lastly, we've enjoyed a close collaboration with the Montgomery County Department of Health and Human Services, who is not only our local public health authority, they're our partners in providing school-based health services. Next slide. And then to just give you an overview of our overarching principles for COVID-19 approach in the school system this year. I will reiterate our commitment to safe in-person learning, staying current with guidance, data, and evolving science, and also addressing the multidimensional impact of the pandemic, not just COVID and infection control, but addressing and redressing the significant impact in many ways this pandemic has had on our school community and our students and staff. We want to do this through a comprehensive strategy of wellness that speaks to all of these dimensions of health, and then optimizing communication and collaboration for COVID-19 planning and operations as we go forward, making sure that our school community, our community at large, our leaders all understand what our shared approach is going to be, will be a very important focus of our work together this year. Next slide. And then just to give you a few updates in the specific mitigation strategy areas for vaccination, we are continuing to partner with Department of Health and Human Services to provide school-based vaccine clinics for students and staff. These efforts have been extraordinarily successful in bringing vaccination to parts of the county that may have less access and keeping our vaccination rates high in our county. And then vaccines and boosters, including the updated boosters, are available not just for students, but staff and families at our weekend and after-school vaccine events. And then I'll hand it over to Ms. Izzard, who will talk about our specific vaccine clinics in the community.
Good morning again. As usual, from our how we approached the work last year, we're continuing this year with a focus on our Title I school and our after-school clinics. And so this week shows you a menu from there. We'll be at New Hampshire State, Whetstone, and Wallow Road. And we're not just targeting just that community, but also the surrounding clusters. So whosoever can come to those clinics. And then we'll continue our work on the weekends as we've done throughout the summer, and we'll continue to do to offer also those first and second doses as well as boosters.
With regards to testing, one of the updates issued by the CDC in August of this year was that universal screening testing is no longer recommended, meaning testing everybody every week is shifting to more focused, strategized testing, like testing before the first day of school, as we encouraged everybody to do this year. Testing will continue to be available if you develop symptoms at school and present to the health room, and will be able to support testing in other strategic situations. The Maryland Department of Health and State Department of Education extended funding for at-home rapid tests to local school districts, so we do have that support from the state for this school year. And then I will just share that even before the first day of school, in partnership with DHHS, we distributed almost 200,000 test kits to families in the community to support this strategic testing. You know, at this time, folks really have a better understanding of when they're at risk. You know, I just went to a picnic, I went to a baseball game, or I may have been around someone who who had symptoms. So we're really relying on families by supplying these test kits for them at home to be able to test in those types of situations. With regards to masking, our Board of Education voted last February to make masking optional in most situations, unless required by current isolation and quarantine guidance by the CDC. So in all of our communications, you'll see that there are some exceptions. For example, if you actually have COVID-19 and you're recovering and returning early to the school environment, you're required to wear a mask. Or in certain outbreak situations. This time last year, we quarantined thousands of staff and students. Today, we've quarantined none. And we've done that by moving to this new CDC recommended strategy of keeping kids in school if there's been an outbreak, as long as we can promote masking and other elevated mitigation strategies. Then in terms of case management and reporting, we're continuing to work closely with DHHS on outbreak management. Staff and families continue to receive notification if their child has been exposed to a positive COVID-19 case reported to us in individual higher risk situations, for example, an elementary school classroom or an indoor sports activity. And then we are continuing to improve and work on our COVID-19 online dashboard, but it shows self-reported positive cases through our online tool. And we're working on streamlining how we receive and report those cases to the community. And then lastly, I'll share with you some of our resources which are available in your materials in terms of the comprehensive recommendations in our fall 2022 opening plan, and then the details we've shared at the opening of school. Both Dr. McKnight issued a statement, a link to our online COVID portal, and the welcome message that I issued with more details about our starting plan for the year. Thank you very much.
Thank you. I'll just note, I was about to say Dr. Jawando. Councilmember Jawando has joined us virtually, and unfortunately, Council Vice President Glass will not be able to join us today. And I will now turn it over to Dr. Kroll, who has a quick update for us.
Good morning. Thank you, Council President Albornoz, and good to see you all again. Before I do that, I wanted to just do one other thing related to our COVID-19 report, and that is to report, share with you all that, let me take this off so you can hear me a little better, is to report that we have our wastewater contract in place, and we expect to begin to collect wastewater data from wastewater starting in October. So I think it's something we didn't put in the original report. I want to just share with you all. So that'll give us another tool as we go into the fall and winter for tracking what hopefully is a diminishing disease. I wanted to give you all just briefly an update on the status of the health officer. I know we're going to come back at the end of the month and talk about it, but wanted to take this moment just to share with you that we have made some progress, and I wanted to share with you where we are, so you just to keep you up to speed. I have filled 3 senior level positions in the department since I've been in the job as director. And this one is nothing has been nearly as challenging as this one has turned out to be. We're not alone. 3 of the 24 health officers in the county positions are now vacant, in the state are now vacant. And there are several more health officers that I have that are intending to leave their posts sometime in the near future. So it is still the great resignation that seems to be happening amongst health officers for all the reasons that we've already talked about many times. The good news is that we are interviewing a prospective candidate. The county executive is scheduled to meet with a candidate within the next week and a half, I think. And we are at the same time working to schedule up an interview with the candidate with the state. They are interested and want to move forward as quickly as possible, and they have promised us that when we send them information, they will expedite an interview with the secretary and the deputy secretary for the candidate. With a little bit of tailwind, we should be able to, and if all goes well with those interviews, we may have a nominee by the time we get to the end of the month meeting that you referenced earlier. I say all of that to say that we have been down this path before, and we've gotten to this spot before, and we have lost candidates for a lot of different reasons. Our sense at this point is that my sense at this point is that we have a candidate that is interested and has remained interested despite the complications of the job and the challenges associated with the job. And it's one that we think would be a good fit, not just for the role of health officer, but for the role of being a part of the entire Department of Health and Human Services. So we're looking forward to hopefully in the near future being able to name the person and put a nomination forward to the council pending the county executive's approval and decision.
Thank you very much, Dr. Kroll. So we look forward to that more formal update on the 29th, and hopefully we'll have some good news by then. And that is good news regarding the wastewater contract. So I just have one question, and then I will defer and yield to colleagues. And in the queue after I ask my question are Council Members Rice, followed by Council Member Reamer. So unfortunately, a lot of the negative attention that has been placed on vaccinations generally, not just COVID, but just generally, appears to have taken a toll nationally in some of the rates of vaccinations that we were seeing among students returning to schools, more so in other parts of the country, less so here, fortunately. But it is of concern. I started out my professional career working for Children's National Medical Center, and one of my first assignments was to represent the hospital in the then first citywide immunization campaign. And that was almost 20 years ago. Actually, it was 20 years ago. And it feels like, unfortunately, all those strides that we had made may have been, taken some hits, and because of a lot of the misinformation that can often confuse parents. Can we talk just briefly about what the efforts are currently, not just, again, related to the COVID vaccination specifically, but more vaccinations more generally, and the collaboration between MCPS and the Department of Health and Human Services, and any data that you all can provide or information on vaccination rates from students coming back this year? And is there any cause for concern, or are we in good shape?
Thank you for your question and for your commitment to pediatric vaccinations. We have learned so much during this pandemic about vaccine readiness. We talk about vaccine hesitancy, but one thing we know in pediatrics is parents, when they are making important vaccination decisions, there are so many things for them to consider, and then having to make that decision during a pandemic, during a time when you may have had less contact with trusted providers and professionals, can be even more complicated. One thing that I was really impressed with, even before coming to this job, was the outreach, for example, to Spanish-speaking communities was very successful in increasing vaccination rates when we went into communities and we answered people's questions. And we also closed access gaps by making vaccines available. And at Children's, we've had great success with mobile medicine, for example, and really breaking down what is it that we need to close that gap, because it's not always misinformation. Sometimes it's mistrust, but I think we need to give parents grace in terms of they just want to do the best for their children, and supporting them in making those decisions involves asking them, what is in the way? What are your concerns? And also, people have had a hard time just simply getting to the doctor and having those conversations. The decisions for children in terms of vaccinating, I think parents are a lot more wanting to do that in the context of regular medical care, which has been harder to access during the pandemic. You're less likely to take your 5-year-old to the Giant, for example. You want to talk to the person who's been taking care of them. So making those access or understanding what it is communities need to make those decisions for their children, and also closing access gaps by bringing the services to them in the form of trusted child serving providers, which includes the schools. So I'll defer to Ms. Izzard, who has been long doing this work in the communities, and which has been very successful collaboration with DHHS.
Actually, today, in 3 of our middle schools, we're having clinics. We worked with DHHS to put the clinics in some high impacted communities. Yesterday, we had 3 clinics, again, with the partnership with the Department of Health, to ensure that no student is locked out of their education due to immunization. As of this point right now, we're in the high 90s percentile for our 7th graders and our 8th graders. Our 6th graders are catching up. We will know some of those exact numbers as they unfold, as DHHS report out those numbers to us, but there's some concentrated effort there. And of course, our people personnel workers are working the phones along with our nurses and going into the communities to ensure that that message is given to our parents.
Is that number about average for in previous years, or is it
well, you know,
about the same?
President Albornoz, we had that gap last year due to COVID, but it's along the line of where we have been in previous years. Montgomery County has been successful at getting our kids and access to their shots in order for them to remain in school. So we should have a clear numbers within the next few days, because the 19th is slowly approaching us, and that is that cutoff date with the state.
Great. Thank you. That's very helpful. Appreciate that update. I'll now turn to Councilmember Rice, followed by Councilmember Reamer.
Thank you very much, Mr. President. And I first want to start off with accolades. Yesterday evening, I got a text message from, I assume, DHHS saying, hey, the bivalent vaccines are now available. It was at 7-something in the evening. It was great. Because, again, continuing to reach out to the community and remind them that we have these new bivalent vaccines that are out that are going to help to mitigate some of the challenges that we are expecting to see in the fall is incredibly important. So kudos for that. I did want to ask about a couple questions, just very specifically. For those who have come down with COVID multiple times, who had assumed, when we first started with COVID and we were talking about you got it once and that led to a certain amount of immunity, and folks assumed, a lot of folks, that they could just do whatever they wanted to because they had now had immunity and were immune. And we've now seen, it seems to be, more folks that are getting COVID twice. And so I'm curious if we're tracking those numbers as people who have contracted COVID more than once, and then are starting to link any of those things together, if some of that work has been done. And then I have another question following that one, but did want to ask about that first.
Yes, so that's a great question. And one of the things that we've seen, this is being tracked by the CDC, by researchers at educational institutions. And one of the things they're reporting is that those recurrent cases of COVID are more common in individuals who are not vaccinated. And so what that's leading us to believe is the immunity that comes from an exposure, comes from recovery, is not as strong or as robust as the immunity you get from multiple doses of a vaccine, and as well as booster doses. So the individuals who believe that, I got COVID, I'm immune, I can't get it again, we know that's not the case. We know that even individuals who are vaccinated are able to be infected, but it's very likely that those infections are shorter, and in some cases may not be symptomatic. So, but where we're seeing more in fact, when we look at our data for unvaccinated versus vaccinated, and we continue to see cases, it's because of the recurrent COVID. So that's where we strongly recommend vaccination. In addition, even if you've been exposed, vaccination is important.
That's actually a really incredible, from my perspective, an incredibly important point for those who continue to feel as though they don't need to be vaccinated, and especially those who feel as though they don't need to be vaccinated because they've had COVID before. And so I think that maybe we need to make sure that that message is out there so that we can possibly reach some of those folks who still may be resistant to and may say, you know what, now is a time where, especially with us approaching the fall and approaching a more contagious season where we may have a rise in these cases, where we may want to try and hit them again with the fact of that, because it does dispel a lot of the myth that's in a lot of communities that talks about the fact that because you've got COVID once, you don't have to worry about getting it again. So I appreciate that. And then long COVID symptoms. Folks have been talking about this for a lot. For the folks that are watching, what are long COVID symptoms? And if you have them, should you do something? Should you be seeking out your doctor? Should you just say that, well, I've had a persistent cough that's been there since I've had COVID that hasn't gone away? It's really not that much of a bother, but it is something that's happening now. What do we tell folks to do in terms of following up, making sure that it may not lead to something more severe? Could it lead to something more severe? All of those kinds of questions are floating out there as well.
Yeah, I'll start, and I don't know if Dr. Bridge wants to come up and add to this, but so I actually wrote down a few notes on long COVID because I didn't want to give them an opening, but I figured there might be questions about it. So there's actually been some really interesting research that's been published actually within the last 2 weeks. And there was a great article, I think, in the Boston Globe that I would ask anyone who's interested to pay attention to. It talks about the persistence of long COVID and the implications that it's going to have. And so the symptoms of long COVID are quite diverse. They often are mostly associated with a condition often called brain fog, malaise, fatigue, chronic inability to feel like you can feel rested, and it impacts across the entire spectrum. The interesting paper that was published about 10 days ago focused on what may be causing long COVID, and the analysis provided by the researchers was that there may actually be a persistent infection with COVID-19 in small reservoirs throughout the body, which continues to release small amounts of the spike protein into your blood and actually causes a chronic immune response in your body, which keeps you in that tired phase. Now, that's an initial paper. It's very interesting. There's been a lot of commentary about it, but it may give some rationale for why you may see that. You see it across the entire age spectrum. You see it across, those who, I think you're 50% less likely to experience long COVID having been vaccinated than not, and so obviously vaccination again provides further protection. But yes, if you are experiencing long COVID symptoms, you absolutely should talk to your physician. There is an increasing interest in the medical community in trying to identify those who have it, treat, and as we better understand the causes, be able to provide some real responses. But there are supportive care processes that the doctors can do to try and address the symptoms of long COVID and allow people to get closer to feeling like their normal self. But until we have a better understanding of if there are reservoirs within the body, where those reservoirs are, and how to address them with either antivirals or other things of that nature, then it's going to be a difficult thing to fully understand and cure. But in the interim, absolutely people should seek their primary care physician.
So one other thing that I would add, Councilmember Rice, is just that as Dr. Stoddard, I've been in the research Carol's pulling up research articles on this, and particularly interested in the cognitive impairment around long COVID. And it does create what people are calling cognitive fog, but that translates into some slowness in thinking and slowness in processing, slowness in memory retrieval. So things like chair, the word, adjectives kind of disappear from people, and they struggle to pull that information back up. So it slows down some processing. One of the things that I've asked the team to do, and they've begun to do, is to collect the research around long COVID to begin to develop tools that we can use, that people can use to understand whether or not they may have long COVID, and our healthcare professionals, including our behavioral health folks, can use as part of their assessment of what's going on with someone when they come through our door. Depression might look like long COVID. Some of the symptoms of depression might overlap with something like long COVID. So we want to make sure we get it right and make sure that people understand that this may not be something that is endemic to their cognitive functioning, but may be something that is a residual of a disease. So as that develops, we will share that with you all.
And I know I'm at my time. I just wanted to just ask for consideration when you're doing that to just please, we know, and I think Dr. Stoddard, you were the one who said it, that it seems to affect people differently. And so I'd be curious as to whether or not folks with pre-existing conditions maybe are more susceptible to more serious long COVID, or vice versa, or whatever the case may be. that kind of thing would also be incredibly important as we invest so much in our BIPOC health initiatives to start having those conversations with so many of our community members who we know were at risk for COVID itself and may now be at risk for some of those long COVID symptoms, and maybe trying to track some of that as well. I don't know if you have some thoughts on that.
Well, we know that where there are pre-existing conditions in a number of cases, especially immune conditions, that COVID and where there has not been vaccination or sufficient boosting, that COVID affects them differently and doesn't help those pre-existing conditions in any kind of way. So there's a presumptive bias on our part that that's a problem. I think as we get more data about long COVID from national research and studies that Dr. Stoddard is referencing, it'll be clearer how we parse out those details.
So if we could, at just closing, just make sure that we reach out to our community and just let them know again about long COVID symptoms, how to identify, and then to certainly seek out their physician to help and assist them with that. And then also when it comes to the non-immunity that exists from having COVID the first time, and that there's still a need for us, I think those would be incredibly important. Thank you so much, Mr. President, for your indulgence.
Thank you. I've got Councilmember Reamer, followed by Councilmember Friedson, then Councilmember Navarro, and then Councilmember Katz. And colleagues, just respectfully, we can try to keep it to the 5 minutes because we still have to get to the Thrive update, as well as a number of other items on the agenda this morning. Councilmember Reamer.
I'll try to be brief. Just to continue on the long COVID conversation, I had COVID at the end of July and into early August, and I still have a cough. But what I understand is that it would not really be considered long COVID because it's not actually disrupting my daily life. And that's like an important distinction, is like whether you can do your work, whether you can do the things that you need to do in your life. And so, you know, there's just a threshold of, so when we are talking about long COVID, we are talking about people whose lives are significantly disrupted, as opposed to an individual like myself who I have a continuing cough. It is frustrating. It's challenging in social situations because people think I might be contagious. But there's a distinction there. So in any event, just wanted to add that to the conversation. My question is about isolation policies for our MCPS and county employees. Are we adhering to the CDC, like 5-day, and then is it test or return? How are we handling that? That's question one. And question two, if you can share anything about your sense of a forecast, are we, have the waves that we've experienced all been driven by new variants? And so we should expect that we won't have a crushing wave, you know, going forward without a new variant? Or are the existing variants that are out there sufficient that in the winter we should be expecting, because as we go indoors, we've had multiple winter, crushing surges. How do you think about that issue? Particularly interested, of course, in MCPS, as should we be expecting a repeat of last year's Omicron wave, or do you think that how do you factor in the necessity of a new variant to drive something like that versus what's already out there? So I'll start with MCPS if I could. Thanks.
Thanks for your question. With regards to isolation policies, we are following CDC's guidance to isolate for at least 5 days, and if your symptoms are getting better and you feel up to it, being able to return to the learning environment as long as you can mask on days 6 to 10. The test to stay strategies that were put out last year were retired by the CDC, so we are following their alternative quarantine guidance that I mentioned. That's for folks who don't have symptoms. So if you're exposed but you don't have symptoms, we call that quarantine. And then if you're positive for COVID-19 and have symptoms of infection or don't, we call that isolation.
So after 5 days, if you've tested positive, if you're symptomatic, then you continue to remain home. If you're not, wear a mask until day 10. Is that what you said?
So the CDC guidance is to isolate for 5 days and then come back as early as day 6 if you're feeling better and don't have a fever. Obviously, we don't expect people people to come back to work or school if they're not feeling well. But if you're asymptomatic and your symptoms are mild and they are improving, you can return as early as day 6, as long as you can mask for day 6 to 10. And then in the educational environment where we have young children or students who may not be able to effectively or safely mask due to health considerations, we need to provide accommodations for alternative strategies for their protection.
That's the same policy for students and for staff, and it sounds
Yes,
like
sir.
also. Okay, thank you. And Dr. Stoddard or Dr. Kroll?
I think the only place where we're doing anything different is in the correctional environment. We do do a test to come back because obviously that's a very closed environment, and both for the those residing in the facilities as well as the staff. I think we do a test on return, and if you clear the test, you come back.
Okay, so that's interesting because some people are doing tests to return in their workplace, maybe voluntarily, and we're not, we're not doing that. It's 5 days, and then it's based on how you feel and your symptoms. It's not a test to return requirement after 5 days. Okay, thank you.
That's correct, Councilmember. The one thing that it's voluntary, but when you've hit your 10th day, you may choose to do a test to see if you're still contagious. And if that test comes back positive even after 10 days, we would suggest considering to continue wearing a mask until you have a negative rapid test. We're not saying that for PCR, but with the rapid test, it can give you an indication if you're still contagious. So that, again, it's voluntary, but that's one of the CDC recommendations that individuals may want to do.
But between 5 and 10 days, we're relying on the employees' determination of how they feel and whether they think that it's appropriate for them to be in whatever their work environment is that they have.
That's correct. And again, with the guidance to wear a mask through that
With
10 days.
with mask guides. Okay.
And we are continuing to ubiquitously provide both to the public as well as employees rapid test kits and N95s, and that will not stop. We have no plans to stop that. Certainly.
I want to say I appreciate that. We've been picking up 2 tests every week or 2, and we've needed them. It's been very helpful. Thanks.
So one quick follow-up on your opening comment, your opening remarks, Councilmember Reamer, about the thresholds for long COVID. This is what defines long COVID is still one of those things that's still in research and still being figured out, actually. So I would say that there is, as you describe it, a cluster of symptoms that makes it impossible for a person to do their work. But there may also be medium and mild levels of symptoms where not all of the clusters of symptoms, all the symptoms are showing up, and where the person may be able to work, but they're slowed or it's impacting them. So it'll be a range of reactions that will define long COVID, not just the deep end set of cluster of symptoms.
Thank you very much. I've got Councilmember Friedson, followed by Councilmember Navarro, and then Councilmember Katz.
Well, thank you so much. Appreciate it. It's nice to meet our new medical officer from MCPS. So, Dr. Kapanen, welcome and thank you for your work. And I appreciate you clarifying and making sure that everybody understands the current protocols of following CDC. I think it's really helpful for everybody to know that. So thank you for your expertise. We certainly need it, and glad to hear that the collaboration between MCPS and DHHS is continuously improving, and we're building upon the successes. I think we've had to coordinate and collaborate more than ever before, and obviously that's always going to be a work in progress, but it's good to see that is happening, and your role here helps with that, and hopefully we have a progress on the health officer conversation. As was noted earlier, I'll save my comments and questions on that for more appropriate venue, but I'm glad to hear that perhaps we might be progressing. Understand that there are some real challenges in that field that have impacted jurisdictions across the state, across the country. We're here to support the public health field, and I think you have seen that throughout this pandemic. With that, just a few quick questions, hopefully. First question, it's about tests that we have available. We've been providing available. I think they've been very well received. I will say our library teams and the rest of county government who have stepped up to help in that effort have been extraordinary. I just want to acknowledge and thank them. The other duties as assigned column has grown dramatically over the last couple of years for our teams and our public employees, and we're very grateful for that. I know residents are very grateful for that. I think it's one of the reasons why we're doing as well as we are. The federal government, my understanding is shutting down their program to provide free tests to families to their addresses. My USPS stash, I only had a couple boxes. Those are long gone, and so I just wanted to get a sense of where we are in terms of providing tests at sites. How is that going? What's the supply looking like? Are we intending to keep that, through the winter months and moving forward as an option for residents to know that that will be there when they need it?
We certainly have been working collaboratively with the Department of General Services, Health and Human Services, and myself to, yes, we're going to continue to make them available through the winter months. I think we're sitting somewhere between 400,000 and 500,000 test kits still on hand at this point. Several million N95s still at this point. So we expect, even with the changes that we've seen, both in terms of the federal program having ended earlier in September, as well as there has been a reduction in what we've received from the state of Maryland in this area. However, we do believe we have a stockpile sufficient to get us minimally through this potential fall winter period, and then we'll reassess as to how we move forward with that program into the future. Obviously, we do also know that the FEMA reimbursement eligibility will come to an end, or is planned to come to an end in December 31st. So that obviously will impact our decision-making process after December, but we do believe that we have sufficient resources and kits, masks, and process to continue. We are also continue to be engaged with a local company, 2020, on the availability of PCR test kits. We currently distribute them through 5 sites. We're actually looking at potential for a possible expansion of that so that we can defray some of the human capital costs of doing PCR testing within the Department of Health and Human Services as well. Hopefully more to come on that in future updates, but we continue to look at ways to streamline, make it easily available, and also reduce the overhead associated with the personnel for distributing some of those resources.
I appreciate you bringing up that last point. I think both on the financial cost and the human cost, we do have to start thinking about the transition to what does this look like when we have annual boosters. Most likely, it appears that's where we're headed. For healthy, generally, non-at-risk individuals. What is this going to look like for moving forward to, allow people to have adequate access? We saw what happened when we relied on the National Strategic Stockpile. We don't want to be a hoarder as a county government that is one of 3,000 plus county governments. We don't want families to be hoarding supplies, but we also don't want to be in a situation where, come the winter, you have a situation where people are returning from their holiday celebrations and other activities and are scrambling, going from private business to private business, trying to get their hands on tests that they need to make sure that they're not putting people at risk. So finding that balance is going to be important. I think the months, the next few months until we get to December, to make sure that we can carry ourselves through the budget period to next fiscal year, and then thinking through what next fiscal year and the subsequent fiscal years are going to look like, and just what we should be planning as a local health department. It's a new ball game that we're in. I think we all recognize that. And so hopefully we have some time now when things are a little bit calmer, at least, to really think through, and hopefully we can work together, executive branch and council and MCPS and DHHS, to really think through what that looks like moving forward. Boosters. Councilmember Rice talked quite a bit about the bivalent booster, and I think speaking to Councilmember Reamer's comments, my sense would be the impact of the current variants, BA4 and BA5, which seem to be the dominant variants, what impact that has if there's no new variant would have a lot to do with how many people get the bivalent protection for the BA4 and BA5. The more people that we have getting that updated booster, the less likely it is to spread here in Montgomery County and throughout the country, throughout the world. There are no borders that protect against global pandemics, as we have unfortunately learned. Just wanted a clarification on that, because I think there is some confusion of who is eligible for the bivalent booster and when. We have a lot of residents, because folks have stepped up, who have gotten 2 boosters, and now there's a bivalent updated booster. At what point for those who are boosted. I believe that's available now if it's been a few weeks, but particularly for those who have been double boosted already, at what point are they eligible and recommended to get an updated bivalent booster?
Well, the good news in this, and I know it's been very complicated over the last year or so for individuals who are immunocompromised or for those that are waiting on boosters. It's gotten a little simpler with the eligibility for the new bivalent booster. Anyone it's been 2 months since their previous booster or since they completed their first series can get this booster. So this is an opportunity for those individuals who've already gotten 2 boosters to get a third one, or for those who are not yet eligible for a second booster to get that one. So they're simply saying you're eligible for 1 bivalent booster following any of your previous vaccines.
So it's been 2 weeks since you've gotten a shot.
2 months.
2 months, okay, sorry. So it's been 2 months since you've gotten a booster shot, regardless of what that was, first or second booster, you are eligible for bivalent booster, and we strongly encourage you to do that, and they're widely available. I just checked a couple of pharmacies. I know you mentioned they're available, with the health department, some of our partners, but they are widely available in the private and the public sectors. I just thought that was important to raise, and the likelihood you believe that, I just want to clarify, because my understanding is this is likely going to be an annual, like a flu shot, which we also encourage everybody to get. It looks like this could be a tough flu from what I understand in other parts of the world. That bivalent booster is going to just be likely the annual, potentially going to be an annual booster that gets tweaked like a flu shot to protect against whatever the latest variant is going to be. Currently they're BA4 and BA5, but it could be something different next year. Is that your understanding?
Yep. And again, encourage people to get their flu shot. The flu shots traditionally have multiple strains in them that protect you against it. Next year's booster could have multiple strains as well. Again, the only caveat as far as this bivalent is for individuals 12 and up currently. They have not extended it to the younger age group can get boosters, but is currently the existing booster. And at some point, we're hoping the FDA and CDC will expand that as well.
Great. Okay. Thank you very much. Really appreciate all the work, and thanks for that clarification, Dr.
Yeah, I just want to add one more piece. As far as timing goes, obviously it takes approximately 2 weeks to get immunity. So if you're thinking about the fall plans, and obviously we have Halloween will be sort of the next major holiday where people might be gathering, and then obviously more prominently probably Thanksgiving. So obviously make sure you time out when you get your booster. You can get it now and you'll be protected all the way through the winter months, but please do think about what your plans will be for the fall and make sure that you've gotten it no later than 2 weeks preceding Thanksgiving most likely.
And the last piece that I would add to that is just that is to include flu shots in that conversation one more time, because they're available and now's the time, and the same routes of transmission for COVID also apply for flu, and you don't want your immune system made more vulnerable by catching the flu first.
So this is Protection Month.
This is Protection
also,
Month.
Yes. We celebrated, but this is Protection Month. Flu shot, updated booster shot. If you are 12 and older, make sure you get your bivalent booster. If you're under 12, get a booster if you're not yet boosted.
And I would also add, just to say that as people move around and are traveling, that we don't have mask mandates, but it's still a prudent thing to keep them with you and to use them, especially when you're in spaces where you don't know the status and vaccination status of other people and where you're in close proximity with folks. It still is common sense.
Thank you. Councilmember Navarro, followed by Councilmember Katz.
Thank you, Mr. President, and thank you to the all-star team here who has been steadily leading and really achieving extraordinary results for our county. Has been really incredible. I wanted to welcome Dr. Kapunen. Thank you so much for stepping up to do this extraordinary work. And I was very impressed with your description of how you're addressing the school system is addressing the COVID, the impact of COVID and how holistic it is. And so my question, very quick question, has to do with the high school wellness centers that we, the council, did adopt and the county executive supported in the school system, the expansion of wellness centers to all high schools. And so how is that being integrated into what you just described in addressing the holistic impact, addressing the impact of COVID in a holistic fashion, And then also, what are some of the conversations around middle school? We were thrilled as we toured the Odessa Shannon Middle School to tour the Linkages to Learning space, and the principal, and there was a really good conversation about how important it is to integrate also those flex spaces into schools. So how is that going overall, and how will these high school wellness centers play a role in what you're trying to achieve?
Thank you for your question. We, last Thursday, presented to the Board of Education a very detailed description of what this mental health expansion is looking like and the current status. But I'll try to be brief because that was 90 minutes. The COVID pandemic has really revealed, not just caused, but revealed an evolving crisis in mental health that's specifically impacting and becoming of concern to children and adolescents. So simply expanding and recognizing mental health supports is part of redressing and addressing the ongoing impact of pandemic stressors. The high school wellness center expansions brings additional mental health services to those high schools that don't already have comprehensive health suites, which include mental health services. This is a great partnership with DHHS, but also internally, we are supporting additional staff to address mental health, and the challenge in those schools is going to be integrating it at every level with how we take care of children and their families. And I'm so glad that you brought up middle school, because the Wellness Center of Expansion talks about high school specifically, but we are thinking hard about what mental health supports and what are the other global impacts of the pandemic on our elementary and middle school students, as well as our staff. So this comprehensive approach to mental health speaks to a need that has been evolving over time, that has been more revealed during the pandemic, and integrating mental health services and supports into the way we think about services in the school arena is part of that comprehensive approach. And then the other thing that I would share is that at very high strategic levels, we're thinking about everything we're doing through a health lens, through a lens of social-emotional wellness. So it's not just showing up for yoga or something else you might do after school, but thinking about how we deliver education, how we plan our work as staff, as leaders. All of this needs to be part of a comprehensive approach to how we think about wellness and how we do our work every day.
Yeah, thank you for saying that. I mean, that was really the thought behind, this proposal, and putting the budget and the money behind this expansion, which was really historic to all high schools, because we were all very aware of what this meant. But are the wellness centers expansion into the high schools, is that going, as scheduled? Is that, happening? Because I know obviously this is going to be a big undertaking. Is that pretty much going forward as it's supposed to be?
Sure, we can give a more quick detailed.
Yes, thank you for that question. It is on point as of now. I spoke with Seth Adams, and so he does see us making it operational. As Dr. Kapuna shared before our board, our partners from the Department of Health did join us, and they see their staffing coming to those centers and having them also on board by October. So those are the dates in a month that we're seeing where all of this support will be in place.
Wonderful. Well, thank you. And again, welcome. Thank you, everybody.
Thank you. Councilmember Katz.
Thank you very much, Mr. President, and thank you to the entire panel and Dr. Bridgers, who literally has your back this morning. I just want you to know that all of our backs, not just you all. And I did have the pleasure of meeting Dr. Coopin last week at the Rockville Goes Purple event. And first off, thank you. I enjoyed meeting you, but thank you for being there as well. Obviously, that's another very important partnership that the Board of Ed and Rockville and all of Montgomery County has together. I actually just have the one question. How fast will we receive the information about the wastewater surveillance system, and what do we do with it once we get it?
I don't know that I can answer the question about how fast we'll get it. We'll start seeing it come in, start collecting it and seeing it come in sometime in October, as I said earlier. I don't know how long it takes the labs to run the process, to process what's in the water and then get back to us with reports. But we are looking at doing this around regions in the county, and it will tell us where in the county, if and where in the county COVID is starting to erupt, even if we're not detecting it through our testing protocols. The message then is the goal for us then is how do we tailor our response? So both in terms of messaging to the local communities, to the extent we can identify and narrow that down using that data, and we would then change how and where we offer testing and how we offer boosters, amping up our booster efforts in those regions as well.
Because it would not only involve necessarily the residents, it could involve, people who are working in the area, et cetera. Not to say that they too, that we're not concerned about them, but that they wouldn't be many times being directly receiving the shots from Montgomery County if they lived in Frederick County.
That's true, and I think one of the stances we've taken is if you work in Montgomery County, you can get boosted here.
Yeah.
If that will help folks, but the messaging would have to be out to whoever was in that region, whether it's employers to be mindful of their workforce or folks who are residents in the area, as well as schools that might be in those areas as well.
It gives you about a 10-day to 2-week lead time from when you see the samples testing running test positive and the increases there, and it will show a similar ramp up. So it's not just is it there or not. You'll likely see it there all the time, but it gives you essentially the burden or the viral load that you're going to see in the wastewater, and that'll give us lead time to start messaging and talking about to specific communities about not just boosting, testing, but masking and giving lead time, because I think it'll help us prevent surges from being as having the peak height that they might have otherwise had, because we can get ahead of people actually already being infected by warning them that infections are on the rise.
We could also say to them, the infections are on the rise, put your mask back on. This is now amp up your own personal security measures and safety measures. Keep your distance, stay out of those tight public spaces, and wear your masks and practice proper hygiene.
Thank you very much, and thank you, Mr. President.
Thank you. Thank you all very much for that robust and very hopeful presentation. We are continuing to make progress, and we really appreciate your leadership. We will now move on to the next item on the agenda, which is a presentation and update regarding Thrive 2050. And while our panelists are coming forward, I just have a quick housekeeping note to share with colleagues. We do have a hard stop on this particular component of the discussion at 11:30, because in addition to the presentation regarding African Heritage History Month, we are also, we've been informed that the consultants have a hard stop at 11:30 as well. So we will do our best to stay on track after the presentations and acknowledge this is, this will likely have to be continued. Yes. Got it. Awesome. Great. Thank you. That's great. Okay. Great. All right. Thanks, everyone. So just at a very high level, and then I'm going to turn it over to Ms. Dunn to sort of set the stage here. But we are sorry, getting text messages. We are following up on the important conversation that we had prior to the recess, acknowledging that for many in our community, there was a feeling that we had not done enough to be able to conduct outreach and receive feedback, especially from those communities that will likely be the most impacted by the policy decisions set forth within Thrive. And while we do give a lot of credit and appreciation to the planning board and staff for their ongoing efforts to engage the community, it's not their fault that we began this process in the midst of COVID. And so it's important that we do hear from those voices, and that brought us to this morning, in which we will be receiving an update on the work of our consultants to conduct that expanded outreach. So with that, Ms. Dunn, I'll turn it over to you to sort of set the stage.
All right, good morning, everyone. So correct, we are here to get a briefing from the consultants who've been working all summer on doing the outreach to the targeted communities that you directed them to do. They have provided to the council their report on that work. In addition, that includes a chapter on racial equity and social justice as it pertains to Montgomery County and is relevant to the Thrive Montgomery 2050 plan. And those things are posted on your website, on the council website, under the Thrive webpage. But I'm going to turn it to them. I'd like them to introduce themselves again to you for anyone that hadn't been a part of their introduction that came earlier this summer. And given our brief amount of time, I don't want to take any of it, but when they are finished, we will revisit the schedule just very briefly so that you know what's coming in the weeks ahead. With that, I'll turn it over to our consultant team.
How about I go first? Push the brake button. There we go. I'm Charnel Hicks from CH Planning and Inspire Green. Thank you for inviting us to assist in this effort. I'd like to pass it over here, and then we'll hear from our project manager.
Good morning, Steve Brigham from Public Engagement Associates. Pleased to be here.
All right. Good morning, everyone. Jordan Exanis with Inspire Green CH Planning. Very happy to be back here to talk through the work that we've done over the past several weeks, which we heard a lot of interesting things about the county and the planning process. And so I'm here to kind of summarize what we've heard and talk through the work that we've done to address some of the issues that we heard from the community and how to make the work of planning in the county stronger and more representative of the diverse voices that live here. So just to give an overview again, the goal of our work was really to connect with the Black, Indigenous, and other people of color, what's known as BIPOC communities, as well as low to moderate income residents in the county, and somehow gather some meaningful input on the Thrive 2050 plan recommendations, and then to summarize that feedback in a report and develop a new plan chapter on racial equity and social justice to support the Thrive deliverable. And to do that really required some very focused work. These communities are undeniably very difficult to engage and requires a significant amount of mobilization to get people in the room. And so our first step in approaching this work was to identify where the target populations live, where we needed to do outreach. The map that you're seeing here is just analysis that shows communities that have over 50% of the population that is not Caucasian, and that meets certain income thresholds that demonstrate that they are either low to moderate income or living below the median income level for the county of $111,000. The other thing that was really important to doing this work was to leverage the existing community groups, organizations, et cetera, that are already working in these communities. It would have been virtually impossible to do this work without leveraging those that already have relationships with these folks. And so we worked with over 50 community groups in the county to help really create a personalized approach to talking with people, getting them involved, inviting them to focus groups, hosting meetings in places that people are comfortable with, leveraging folks that do canvassing work, going door to door, talking to people, and doing pop-up events in the areas where these folks live to make them aware of our effort and promote the outreach tools that we were using to gather feedback on the plan and people's perspectives on the issues in the county. So one of the things that we had to do was look at the prior planning effort conducted by the county and the planning department. And while this is a somewhat difficult task because we weren't there, we heard a lot of things from the community, we kind of summarized, even though there's a lot of great outreach that occurred, some of the main things that we heard about outreach in the past was that there wasn't really strong racial representation amongst those who participated. And even though we do not have hard numbers because no demographic documenting or reporting was done on who was engaged during those first 2 years of outreach, we did manage to, through our questionnaire, which we'll talk about in a minute, kind of poll people who were previously engaged and figure out some demographic information about who they were. And that really yielded to show that the vast majority of folks that said they were involved prior were majority white, majority from West County, majority incomes over 100K, and it's not really representative of the folks that we were seeking to talk to in this process. The other issue that we found is, we spoke with a lot of community groups. There are people who were referenced in the plan as having been engaged. A lot of those people that we spoke to were like, I maybe remember an email, but there was never a meeting. We had a conversation, but it wasn't specifically about Thrive. And so there was a sense that, some of these activities that were documented as having a Thrive meeting with a certain organization were not really as in-depth as were represented. And so there was a little bit of lack of clarity in that regard. So some of the lessons learned, through this process is that, really there's significant, work and resources that's required to engage these communities. A lot of the folks that we talked to, didn't really want to be talked to. They had distrust of us, even though we don't represent the county or any of its processes. They still were a little bit resistant. And so it was really vital that we had compensation for people. We paid people to participate in focus groups. We incentivized our survey. And we offered free food and, other things to try to get people in the door. And this was really essential to make this process work. I think without those incentives, we would have not been able to talk to as many people as we did. And this was especially important given the compressed time frame of trying to organize and launch a comprehensive community engagement effort within just a few weeks' time. So to talk a little bit about the specifics of what we did, our main engagement mechanism was we hosted 8 focus groups, which was with people of color, immigrant groups, working class residents, as well as youth of color. These were 2-hour meetings where we met with people, some in person, some virtually, where we had conversations about the plan, the methodology, the policies and issues, and really gave people a chance to talk about what they felt about the different plan areas, and then polled them on whether or not they felt the plan was addressing all of the issues that they saw in their communities, and whether or not the prescriptions fit how they felt the direction should be going in the future. And then we ended those conversations with, specific, gave people the opportunity to give their specific anecdotes and stories about, how things were working for them, how they felt they may have faced discrimination in the county, things that they felt needed to happen to make Montgomery County a more, equitable place to live. We also hosted a community forum, which had, a lot of interest. We had over 300 people register and about 160 people attend, representative of folks from, all different walks of life across the county. I'd say about a third of those folks were BIPOC, 2/3 were white and affluent, but interestingly had very similar views to the BIPOC folks that we spoke to. And, a lot of folks represented from Silver Spring, Greater Bethesda area, Gaithersburg, Wheaton, and Rockville, is where the majority of folks hailed from. We also had a community questionnaire. One of the challenges of this process is trying to figure out how to achieve this quote-unquote meaningful input on the Thrive methodology. And so we designed a questionnaire, not a survey, but a questionnaire that kind of dug into a little bit the planning themes, and this was something that we distributed widely. We mailed postcards to our target populations. We promoted this through all the community groups. We promoted at pop-up events, and really leveraged those word of mouth and relationships to get people to take this survey. We had almost 2,000 people take the questionnaire, almost 700 of those folks from our target demographic. It really gave us a good base of information to compare with what we heard from the focus groups in terms of people's attitudes about Thrive, as well as things that we could be doing better to engage them and plan for the future. To help focus this group, we did organize a small advisory group with people from the county that know these communities, that work in these communities, from key organizations like Impact Silver Spring, MORE, and CASA, and they were involved on the front end to help us plan our engagement, to help us design questionnaire questions and making sure that we were on track. And then we met with them again on the back end to kind of review what we were hearing and get their input on how to prepare for the community forum. And the last thing we did, which I've kind of already mentioned, is pop-ups. We hosted 7 pop-up events where we were out in the community handing out materials and talking to folks and soliciting their participation in our survey and to sign up for a community meeting. So what we heard, generally speaking, I think a fair characterization is that people had a lukewarm response to the plan. I found that, through conversations with people, they generally liked a lot of the things that they were hearing, but they felt that the issues, were not necessarily representative of things that they were facing on a daily basis. And I think because of that, a lot of times the prescriptions seemed to miss the mark, or they felt like, the root issue wasn't being addressed before we got to these policies. And they were worried that if the policies were implemented, that they would be harmed in the process. Housing in particular, folks expressed a lot of concerns about what was going to happen to their communities. And on transportation, it was actually really interesting. People generally supported, the transportation issues, but felt that the policies did not really reflect their day-to-day realities. I think one of the most important things to point out through this process is, we all like and support good urbanism, but there's a lot of people that rely on personal vehicle for their livelihood. And for a lot of them, they felt that, the vehicle represented financial independence. And some of these ideas about walking and biking were beyond what was attainable for them in terms of their lifestyle and economic situation. These are folks that work construction, house cleaners, Uber and Lyft drivers, people who mow grass and, require equipment, require vehicle miles to capture as many jobs as possible to make their livelihood. The idea that they were going to take a train or a bus, it just didn't fit with their reality, and they felt that, that reality was not being reflected in the plan, and that some concession needed to be made for, the economic empowerment of their communities, because they really rely on, car for their livelihood. With regards to design, arts, and culture, I think, people, liked what they heard, but also felt that there was a real missed opportunity in terms of leveraging the culture of these diverse communities and really centering them in things like placemaking, public art, so on and so forth, to really, help capture the tremendous cultural force that does exist in this county, and wanted to see those things go a little bit further. And on a positive note, I think everyone really appreciated the work the county was doing on parks and recreation. We had a lot of heated conversations in focus groups. When we got to the park section, that's when everyone kind of relaxed and said, you know what, I like the parks are great, more of the same, please. So that was encouraging to hear, that folks were pleased where we were going in that direction. So I'd like to touch briefly on some of the themes. I know I've spoken to some of these already, but we didn't talk about complete communities yet, which is one of the kind of focal points of Thrive. I think a lot of residents felt that their communities were complete. Some did not. Some were very resistant to the idea because they felt the way the idea was framed was not realistic for them or attainable for their communities. Some of that was related to the transportation issues that I described before, but also too just because they, I think there was some, legacies of lack of opportunity that they felt, it would require a lot to get to the point where they could do everything within their, immediate community, and did not feel like that was realistic. I think, again, the access to affordable housing was a huge concern. I think folks are really feeling the squeeze of housing prices. And also, too, we heard a lot of stories about programs that were intended to help people not working, whether due to personal bias or racism or feelings of discrimination. We heard folks talking about how, they tried to leverage a foreclosure prevention program and they got foreclosed on anyways, and then their caseworker's brother bought their house. We heard stories about how, people, are complaining about code violations in their building and the code enforcement officers being paid off. And they're in court and dealing with that. Just a lot of these kind of stories where folks are, working to try to improve their stake, and they're being dealt with in a predatory way instead of a way where people are genuinely trying to help them. And I think that's something that's important to call out. We'll get to the recommendations later, but I think a lot of what we heard is we need checks and balances to ensure that these programs that are designed to help people are actually having the desired outcome. Another topic we spent a lot of time speaking to was the idea of integration, both racial and economic. The plan really centers this idea as a way of addressing some of the challenges that vulnerable communities face. And, residents, were open to it. I think they wanted diversity, but they were concerned that it was not going to necessarily benefit them, or that they would be displaced and had to move further away or somewhere else. So they were very skeptical of it. And then there was people who felt, well, what about the other communities where the jobs and things already exist? Are we going to integrate those communities as well? I'd like to live in Potomac or in one of these other areas where the good schools already are. And that was a common theme in the conversation. If we're going to do this, we should be doing it across the board, not just diluting the impoverished areas, but making sure that all areas across the county had a similar demographic proportion that was representative of who lives in the county as a whole, so that all communities had wealth and poverty inclusively next to each other, so that people are interacting and really building the social capital that the plan speaks to. And on the issue of compact growth, there was quite a bit of concern, I would say, in the low-income communities about what this meant. I think folks felt that this kind of extended the legacy of segregation that exists in the county, focusing development in these areas. They're very worried about overcrowding, very worried about maintaining their access to open space and green space, and how to balance this idea of developing and adding density, but also increasing the opportunity to access healthy spaces. And they felt that this would not really benefit their community. So and we heard a lot of kind of like chicken and egg type of conversations about how to do this, what's going to work, what's not going to work, what needs to happen first, which I think are important to highlight in the plan. With regard to the questionnaire, we asked a lot of different questions, but I think the main things that we heard are that for the target population, jobs and economic opportunities are really their primary concern. Commute time was a huge issue. We heard folks that are having to traverse great distances to get to jobs, and they want the access to local jobs. Housing, again, was a huge concern, as well as the reliability of transportation. And in terms of parks and public spaces, there was some discussions about safety, and wanting more things in close proximity to their home. So, shifting to the community forum, this was a very different conversation, and it's a bit harder to follow. There's a lot of different folks represented in the room, so the views and opinions vary a great deal, which I think is to be expected. But I think overall, what we learned is that people really also echoed the sentiment that there needed to be a greater urgency in addressing the affordable housing challenges in the county. I think the broader group was also very interested in environmental issues, and also wanted to make sure that there was, equity was emphasized more thoroughly throughout, the planning processes as well as development. And we also got some input from people in the forum about best practices on community engagement. I don't know that we need to go into these all today in detail, but some of the things they mentioned are things that we tried to do, which is really just making sure that engagement is easy for underrepresented people. A lot of these folks are busy, they have multiple jobs, they're working to survive. Attending a meeting is not high on their list of priorities, and we just need to do more to make sure that things are clear, that their voices are being valued, and that we're doing engagement where it's convenient for people. Some of the big themes out of the forum, beyond what we talked about, is that there was some concern that more was needed to be understood about implementation of the plan and how things were going to work. A lot of people said that the plan was difficult to understand, and that more kind of capacity building needed to happen when having community conversations. I can definitely reinforce this point. I think a lot of the focus groups, people felt that it was too dense, too much material to cover in 2 hours, and they're kind of like, if you do this again, can we maybe focus on one issue at a time? And I think it would really be helpful if this was an iterative process where you spoke to people, talk to them through some issues, give them time to reflect, come back, and allow them to reapproach. And I think there's two big views on Thrive itself. Is that some people thought that the process needed to be kind of slowed down and redone. And some people thought that, we should pass Thrive and make adjustments and, keep looking towards the future and maybe look to revise and refine a few years down the road. So I have, I think this may be a good place to take a break if folks have questions. I don't know if everyone's been able to review the work that's been done to this point. The next, we'd like to talk about kind of our recommendations based on what we heard, but definitely want to give you all a chance to react to what you heard about our engagement efforts and, fill in any gaps that may exist in your understanding of what we've been up to the past few weeks.
Great. Thank you very much for that presentation and that hard work, which I know was a condensed period of time, not optimal, but clearly a lot of ground was made up and a lot of ground was covered. And I'm very impressed with sort of the robust nature through which you tackled this summer. So I appreciate that. I'm just going to say a couple of general comments speaking for myself, and then I will yield to colleagues. And just so everybody knows who's in the queue, I've got Councilmember Reamer, followed by Councilmember Navarro, and then Councilmember Jawando. Anybody else that would like to speak, just please text me. We're not going to please everybody with this document. That is obvious. But what is also obvious is that we can't do nothing. We have to, I think, reasonably come up with a plan that does consolidate and take into account the myriad of different views and perspectives, that helps better connect the various master plans that we have in our community, that each individually in their own right are doing great work in terms of community engagement, but thinking more broadly, I think, is something that most reasonable people could agree is something we need to do. And I'm not sure exactly what the answer will be. But this obviously provides us with more key and important data points that are going to help us as we go through this process. And the process itself, I think there are some lessons learned moving forward that we can apply. But some of the comments that you all shared just really resonated with me in some of the individual conversations I've had with a number of residents who are not as engaged, who are not emailing regularly, who are not participating in all of the sessions that we have had thus far. And so that balance is critical. And the issue of transportation in cars is real. And that's self-independence. And so there are aspirational goals that we all need to strive and work towards achieving. But if you're working 2 or 3 jobs and you have to, even the most complex transportation systems in the world are going to struggle to meet the unique needs of every individual that's out there. So this document is obviously important for so many different reasons, and critically important that we do our best to get this right, and that's what we are trying to do. So I really appreciate all of your efforts thus far. So just some general comments from me. So I am now going to go to Councilmember Reamer, again, followed by Councilmember Navarro, and then Councilmember Jawando.
Thank you. Thanks for your work on this. I heard loud and clear in a recurring theme that we need to do more, we need to do it better. And I think you have, with such a focused effort, you have really developed and innovated and demonstrated a lot of the techniques that we need to really grapple with and improve and use in a more fulsome way in the future. And so I appreciate the work, and I thought you've given us a very balanced review of what you've received, and you've drafted a report chapter for us. We now have that for our consideration and Thrive, and that's going to be enormously useful, and I appreciate all of the work that went into that. And the themes that you've highlighted are enduring, and I can think back to the very first master plans that I worked on as a council member, and we were just discussing those basic challenges of who's at the table and how do you ensure that the full community is at the table and that the views that you're considering are representative to the community. And so you have developed some tactics that I think are really intriguing, polling, focus groups, things like that. So I wanted to ask what you felt was most effective. What do you think were some of the engagement tactics that we should really take some time to reflect on and think more about? And if you could talk a little bit about, in your report to us, you described the difference between metrics on engagement versus outreach. Could you just expand on that a little bit more so that we can think, have that present here as we're considering how to take the lessons learned going forward as well?
Sure. So yeah, I think, big picture, when we talk about engaging quote unquote hard to reach communities, the work of mobilizing, it's probably 3-4-fold the effort of actually engaging, right? And I think that's the part which, for those of us that went to planning school, we had to suffer and endure through, door knocking and phone banking and doing that hard work, to really make personal connections with people, to build relationships and, generate some level of trust so that people will show up to conversations authentically as themselves. That requires a lot of different things, right? It requires cultural competence. It requires a certain level of respect and deference to those folks. I think for poor communities in particular, you need to incentivize people's participation. You need to pay them for their time. And I think, ultimately it really just requires a transparent and honest process. I think people want to participate, but a lot of times they get what we call planning fatigue, right? They've been told over and over things are going to happen, and they don't see it, so they're like, well, why am I going to go to that? It's just the same song and dance. So I think, accountability on the side of, the people who are responsible for implementing things is very important. That being said, I think, planning at its best, it leverages the existing actors. One of the things that, I wrote to in the plan chapter is that, it's never going to be possible to know and talk to everyone, right? So, you have to kind of build those relationships with the people who do have their feet on the ground, who are doing the grassroots work, who are talking to people who already have the established trust, and bring them into your process, empower them to do a lot of that work with you. One of my favorite planning diagrams is the ladder of citizen participation. It talks about, the different rungs of participation where, generally we see, kind of lip service, right? Or therapy. In the worst cases, manipulation. Like, we're doing this and we're going to, throw a bunch of information at you, and, you might have some ability to have input, you might not. But I think what really needs to happen is some level of delegation of power to communities to have more influence over what happens in their communities. And I think, we've said that in these conversations, and people kind of raise their eyebrow. Well, that's already a problem here because da-da-da. Well, it has to be centered on the right communities, right? If it's the same players who've had power for generations making decisions, influencing these processes, you're not going to get different outcomes. But understanding who are the communities that don't currently have any power, who are the communities that are hurt, in what ways have they been hurt, how do we undo that? How do we center their issues? Because at its core, this equity work, it's really seeking to heal what has happened in the past, right? The distrust that exists, it didn't happen overnight. The poverty, all these things, they were created. And in order to fix them, more attention is going to have to be paid in those places. And I think, having that approach, will actually motivate people to be involved. And then once momentum is built, I think you won't have problem mobilizing people. They'll mobilize themselves once they realize that the process is authentic. I've seen this in a lot of my work. We go in, we have a meeting, and people are kind of like, who are you? And then we talk through the issues, and we center their voice in the process, and then people will contact me afterwards and say, oh, thank you for leading an authentic process. I went back to my constituents and we assembled a whole host of comments and we're submitting it to you because we actually think this is a real process, right? They went and did the work on their own and sent content because they felt that we were respectful of them in the process, that we cared about what they wanted to say, we cared about what their issues were. And it really, in my mind, stems from, more so not what you do, but how you do it. And I know it's a big cliche, but I think leading with respect, it's really the core piece of this. Because a lot of these communities, that's a primary value that they hold, right? If you come and talk at me like I don't know, like I'm stupid, it just, the fog goes up and they're just like, they're out of there. But if you come and say, hey, I'm a planner, we want to learn about your community, please tell us what you know so that we can do a better job because your perspectives are more important than mine, then people are, oh, okay, that's kind of interesting, I haven't heard that before, right? And I think that's really central for this kind of work, is to help people understand the community's opinion is more important than the practitioners, because they're the ones that ultimately have to live there, that ultimately have to continue to do the work of making that place work day in and day out. And it's something that you have to nurture and build over time.
Thank you.
Thank you.
I was wondering if I could just quickly add to
Yes.
that. I echo everything Jordan said. I think it's really important to reach out to community groups that have legitimacy in different communities and work with them closely. So 2 concrete examples. We work with CASA right from the get-go. They helped organize a focus group in Wheaton with only Spanish-speaking residents. We did the same thing with Cheer in Long Branch. In a previous project I did with the school system, we reached out to Impact Silver Spring and did several focus groups with different, with Ethiopian immigrants and with Asian immigrants. So, and the same thing is really important with African American communities and low-income communities, who are the legitimate community groups in each of those places that can help do the outreach and help you host meetings, co-host meetings, maybe even lead meetings. That can make a real difference. And what kind of, the stipends really matter. It really matters to people. It says you understand my situation and you're honoring that. But in other projects, we provide childcare, we provide meals, we provide, transportation stipends to help them get there if that's an issue. So it's going the extra mile to understand what their circumstance is and what will enable them to participate and what keeps them from participating in normal processes. I think the last thing I would say, this was something that was echoed several times near the end of the community forum, which is compressed timeframes are the enemy of equity and justice. And I think a lot of people in this process in July and August felt like, oh, they're coming to us at the end of the process and it's really hurried and they got to get our voices and a report gets in and then it's going to be approved. And it's like, well, why now and why is it so hurried now, right? So I think that's really important for the future. How do we engage in the beginning, throughout, the middle, the end, so that they really feel like their voices are heard throughout?
Thank you for that. Just in the queue, colleagues, I've got Councilmember Navarro, followed by Councilmember Jawando, then Councilmember Rice, then Councilmember Katz, then Councilmember Friedson. Councilmember Navarro.
Thank you, Mr. President. Well, thank you so much for this report. It's interesting, you just said that, the compressed time is enemy of equity, and here we are only dedicating an hour to such an important report. So I am hoping that colleagues entertain the idea of having a follow-up discussion because, as I'm listening here, and I'm literally, I think, a couple of months away from finishing my service on the County Council, and we are here 3 months. And we're here because of the Racial Equity and Social Justice Act that I led and my colleagues engaged in, and everyone in the county decided to really invest time, including the planning department, to adopt such an extraordinarily important piece of legislation, because then it sort of forces us to have these conversations, right? It's not a one-off. It's not a, check the box. I've been saying a lot, and people that have invited me to talk about this, that, now the next term and going forward is when the rubber meets the road. I mean, this is when the implementation really is going to now be needed, and it will not be easy. And I think this presentation to me very much, illustrates that. Because a lot of the things that I see written here are things that have been done, right? I mean, the Latino Civic Project that I decided to launch from my office because I was representing the epicenter of the Latino community precisely has implemented all of those best practices. And so there are a number of things, and I was just interested in what you had to say, because again, I don't think this just applies to planning. As a matter of fact, we've just gone through this primary process, and I was thinking, this applies to everything, right?
Yeah.
Political engagement and participation, every single policy area you can think of, this is the blueprint. The question is, are folks interested in doing it or not? Because it does start with respect, and it starts with really, truly wanting to engage folks, right? Because there is this panacea to somehow hard to reach communities, which I also always laugh, because I always say, I remember this one particular immigration attorney way back when I wasn't even in public office on the Spanish language TV stations, and he would say, yo hablo tu idioma. Well, guess what? Dude had expanded all of his franchise because he understood how to get to his market. Mm-hmm. So it's not like they're hard to reach. It's whether we want to reach them. Right. And so this notion of building the civic awareness, civic education, civic participation, that is patient work, and it does take a little while. But I got to tell you, when that light bulb goes off, right, in these so-called hard-to-reach communities, and they're like, wait, you need to tell me that I can influence? Right. where that building goes or where that road goes, oh, I have a lot to say. Okay.
Yeah.
So it's not like they don't have anything to say. It's not that, oh my God, they're just not interested in education of their children.
Right.
The systems have been pretty much designed so that they're not really interested. I felt that when I was a PTA mom, when my 30-year-old was entering kindergarten, I stopped going to PTA meetings because I could not understand what in the world they were doing. And I went to school here, graduated college here, was bilingual, bicultural, everything. So I just hope, and this is more for my colleagues that are come back, this is a really good blueprint for the entire policy work of this council in this county. Because I think it is all contained in one report. Again, it's not like we haven't done it before, because we have. We know the best practices. So, I mean, just curious then, from your perspective, in terms of the overarching, and by the way, just another parenthesis, and this will probably get me in trouble, I'm going to say it anyway. I think that we also have to be careful sometimes with some of the community organizations who also do have a particular policy agenda.
Yes.
Because then how do you know, from a practitioner perspective, are you getting objective input, right? Like I'm really big in just building the leadership strength of people in the community, right? Kind of taking out the middle man person type of thing. And it's very necessary for a lot of reasons. Those community organizations are really important. But I think at some point, folks have been here long enough that if you just give them the tools, they can advocate for themselves, right? So I'm just interested in that perspective, in terms of what you, and I know it was a very short period of time, planning, every policy decision, everything. You talk about a plan that has to be developed. Do you believe that we have the assets necessary, right, the human capital necessary, et cetera, to be able to do that effectively? And if we do forward, with this plan, which is an important plan, I'm very curious to hear what was the feedback surrounding, like, what are the things that should be then modified, going forward?
Sure. So the first piece, I think it's a great observation, because in theory, we wouldn't need a go-between, right? You should be able to, interact directly with people. And you're right, like in a short time frame, it's really hard to know who's who. I think for me personally, there was elements of this, like being a quote-unquote outsider, which was good for me, because I was like, hey, I don't know what I don't know, so I don't know whose toes I'm stepping on, doesn't matter, right? But, there were some challenges, right, where we invited people into the process, and then I realized kind of halfway through, I'm like, oh, this person doesn't like poor people.
Right.
And that was like, it was like, now my spider sense is tingling, like, I have to take everything that this person says with a grain of salt. Luckily, I have the insight to see that. Not everybody, recognizes those things. I think it's really about humility, like, and understanding, like, some of the things I said before, right? Like, centering the people and understanding that, everyone has an agenda, like, in terms of organizations, elected officials, so on and so forth. The plan is really about getting all the ideas and issues on paper and, trying to build some consensus. And like was said earlier, you're never going to, like, please everyone, but you have to have an honest dialogue about what all the issues are, because without that, then you're only planning for, 2/3 of what the issues are, and you're going to miss things. We all have blind spots. I've been doing this a long time. I talk to communities and they say things to me and I'm like, oh my, I can't believe I missed that, right? I thought I was thinking about those groups, but they have experiences that I don't have, right? Whether they're handicapped or what have you. They're like, my biggest problem is I have to take my wheelchair in the street because the sidewalk's too narrow. I don't think about that on a day-to-day basis, right? So these are things that require those conversations to have, even for practitioners who have been doing this a long time. And as far as capacity, I once upon a time worked for park and planning. They got a lot of people, right? I think it's about having the directive and the staff to say, we're going to commit this amount of people to do this work of, relationship building. Once upon a time when I worked in community planning, I was discouraged from talking to people. This was not here, but in Prince George's County, it was like, why are you talking to these people? And I'm like, well, aren't I supposed to be making relationships with the community? Isn't this what we're supposed to be doing, building trust? And they were like, you need to slow down with the community meetings. And I'm like, okay, well, I think that's the thing that I've seen a lot is that, these people are not always easy to engage, right? You have a meeting, they come in, they're disruptive. Well, who asked for this? I don't want that. Well, I did that. And they start cursing at, all sorts of stuff. We've had police called in public meetings. Like, for me, I kind of like that stuff because I'm like, hey, we're getting to the real issues and you can talk through it. For a lot of people, that's just like, I don't want to deal with that. We're going to just do this kind of really quick and dirty engagement so that we can avoid the problems that we know are coming. But, for me, I feel like you have to face the storm, right?
Well, you do, and I guess I'll close with this. I appreciate you saying that too, because even when I was a member of the Board of Education, and I remember sometimes wondering, do we, when we say we want parental engagement, when we say we want community engagement, do we really? Because the question is not that the public and these communities don't have anything to say. They have a lot to say.
Yeah.
But then when they say it, then we have to respond to that.
Right.
So, at some point you have to also face the reality that, do you really? So let's not put the onus on folks not wanting to participate or not whatever. They also understand that, hey, yeah, maybe I've done that and nothing happened, because at the end of the day, what a pain to have to now address all of these other issues, right? So there is, there are all these dynamics. And so what I will say is that, back in that time, 2004 or whatever, I was tracking the growth of the communities of color in the county. Now, this is a county that is majority people of color. This is a school system that's 73%, students of color. Montgomery College is 78%, students of color. There is no way that this county can thrive unless these communities are absolutely present and their voices are included. If not, we're setting ourselves up. And so, to me, this is why this exercise was so important. And it also has lots of layers about, who are the staff in these institutions and these agencies? Are they empowered? Are the staff empowered to do the work? And again, it's not because it's something, trendy that we should do. It's because for a jurisdiction like ours, again, we're not going to succeed unless we do this. So I applaud all of you. I do think that Thrive is very important. I think it has a lot of elements that are so critical for the future of this county. And I hope that, that we can, I hope folks will feel like their time was worth it in this participation. And then moving forward, we start way in advance, not just with planning, but with all of these other policy areas as well. Thank you. Thank you so much.
Thank you. And I'll just note to Councilman Navarro's point, if we don't get through, and we may not, because this is a very important and robust discussion, then we will look at, and as soon as possible, having a second part to this discussion. Next is Councilmember Jawando.
Thank you. Can you hear me okay?
Yes.
Great. Good morning, everybody, and thank you for very thoughtful discussion. I'm really happy I got to go in the order I did after Councilman Navarro. So just amen everything she just said. I also agree with your comments, Council President Albornoz, and want to thank the Inspire folks for your hard work here. When you said something that I was going to say anyway, but I'm definitely going to say it now because you basically quoted it. You said the message is authentic, right? And the messengers have to be authentic. I often interpret life through movies, and one of my favorite movies of all time is Crimson Tide with Denzel Washington and Gene Hackman. And if you know the plot of that movie, it's about a nuclear missile ship, and before there's a launch, there has to be authentication of the message that's coming from the Pentagon. And they go through this process on the boat. If you remember the scene, they run to these keys and they open the safe, and there's a authenticator. And they go over and everyone has to read it. It has to be a repeated message. It's a series of letters. And at the end, after everyone reads the same series of letters, Denzel Washington, the lieutenant commander, says to the captain, the message is authentic. And they say, I concur, so the message is authentic. I think that these practices and policies and strategies that you've described in this chapter and what you've done in a very truncated period, the outreach, the engagement, child care, the authentic messaging, those were those authenticators. Those were the letters on those cards. And I say that because I think we have to, and Councilman Navarro said this point very plainly, we've done these things in different contexts. The Latino Education Project, I started a nonprofit called Our Voices Matter that worked in low-income communities. We've had versions and parts of this, but I feel like the process has not been institutionalized in such a way that we are doing it every time and building upon the important work that's already been done, the strategies, the proven work, and leveraging it completely. And I think that if I take anything from this, and I tried to manufacture as part of the Fed committee some additional outreach and engagement on my own, and we worked with the council, and then council president put a process in, again, trying to get more people engaged. We have to systematize and authentic, deep, meaningful engagement and not have to recreate it every time. And it's going to change. The people will change. It's just like youth engagement. The kids graduate. You gotta go back and get different kids to be a part of it. But I think that is something that we need to invest in everything we do. Couldn't agree with that point that was made more. And so even to Councilman Reamer's point about the strategies that yielded the most benefits, this is not rocket science, right? People are living their lives. You need to relieve the pressure, engage with them authentically, pay them transportation. Don't try to, talk above them. Don't try to use jargon. Really take the time to get deep, meaningful input, and do it every time. And I think, and it takes, I think we're going to have a real conversation about what that looks like, because it will take time and it will slow things down and it will be difficult. But once you get it going, I think you'll gain some of that. You can move with greater pace. But so I would love to, I'd love your comment now. But is there any place that has done this well? Because I don't think it's just our challenge. I know it's not just our challenge. And this is not to say that we haven't tried to do this in different ways, both as a council and as a county government. But are there places that have institutionalized and systematized this type of deep, thoughtful engagement in a way that we can model as part of our our ongoing commitment to racial equity and social justice? And so that's question one. And two, if not, we're going to need to work with you or with others to develop that over time. And I think that is going to be a really important item for the continuing council and the new council to do, to make sure that we have participatory democracy. So we'd love your comments on that, but also just thank you for what you did and for putting words and emphasis around something I think many of us were feeling.
So I'll start by talking about, is this something that's happened before, something that we've seen, something that we've done? And the answer is yes. The challenge is that it's hard, right? So you do it, you get everybody out, and then you hear, well, we're not here to talk about that pothole in front of your house, right? We're not here to talk about the flooding in your basement, because this project that we're talking about isn't going to cause the flooding in your basement to get any worse. Yes, you got plucked off your car last spring. That's a separate issue. So what happens is folks are like, yeah, well, that was interesting, but Right. So I think that it's a matter of being comfortable, meeting people where they are, and being just putting what you came here to discuss aside from time to time, and focusing on what matters to the people who are in the room, or at least having some way to accommodate that. We need to have more people show up, folks from the fire department, folks from streets at every meeting. sadly.
Right, they can get that solved in addition to you getting your feedback. It's
Right.
two-way.
Right, exactly. So I'll pass to Jordan.
Thank you. I'm glad Sharna went first because it's a tough question to answer. I think there's a lot of best practices out there, and we can certainly delve into that work. Some of it was referenced in doing ours, but I actually want to speak to something slightly different, which is I think it starts with capacity building in the communities that you're serving. One of my mentors, did real community organizing, kind of radical planning work in East St. Louis, a really rough area. And, he was, working at University of Illinois, and he was taking students and they're, cleaning up these neighborhoods and, getting the city government to pick up trash, and they're doing all this great work to improve the conditions for people in these neighborhoods. And, he'd been doing it a couple years, and, he was feeling good about himself, and he talked to one of the gatekeepers, old black lady who was one of the leaders in the community, and he said, hey, how are we doing? Are we doing a good job? Like, you happy with the work that we've done here? And she was just told him, she was like, you and your students have done wonderful work, but, we're not even the flea on the tail that wags the dog. So if you and all your white students decide to pick up and leave tomorrow, we're going to be right back where we was a year from now. And from that point, that's when they started their planning education in the community to teach people what planning is, how it works, how to do it themselves. I think one of the things that really bothers me about this field is I tell people what I do and no one knows what it is. All these hearings are held relative, they're public meetings, but in my opinion, they're behind closed doors. No one understands it, and that's part of the reason why power has been preserved the way that it has, right? We need to open this field up to the communities that we're, trying to help, and like finding that next high school kid who can be a planner in 5 years for the county that understands the intricacies of his neighborhood in a way that I never would hope to, right? That's the kind of work that needs to happen through this process, and I think that's the huge opportunity here, is really working to develop capacity of residents to take on this work on their own, so it's not the burden of the government to figure it all out and do it in this top-down way. Planning by its nature is meant to be a groundswell.
Right.
It's a bottom-up process, and it actually, if it's done the right way, it makes it easier for everybody, right? Because the people want to do the work to transform their communities in a positive way. We all kind of fundamentally want the same things, right? We want us to have, decent quality of life. We want to have our kids go to school, get a good education, and we don't want to bother nobody. Like we all want the same thing, right? So how do we support that in a planning sense? It really starts with demystifying this process. I talked about this in this process is like, okay, something like coming to council to testify on a plan as a person of color, I don't want to go in a government building and testify. Like that's not something that, you know what I mean? Like people need to be able to do this in an environment where they're comfortable, where they feel like they share their voices. It's safe to do so. And I think that's really something that, from the top level needs to begin to be implemented into policies across the board. It's like, how do we get more young people, more people of color, more of these, quote unquote, unheard voices engaged in these processes and building their capacity so that they can have more meaningful engagement. Because what I see throughout this is it's difficult, right? Like we learn these things as good as planners, right? Like bike lanes are good. A lot of people, when you go in their community and talk to them about it, they're like, that's not for us. If you build that bike lane and we're going to get kicked out, I don't want that. And so it's like they don't want the things that's going to make their community better because they see it as a harbinger for gentrification. But if they could do it themselves, if they could understand and figure out, okay, we're going to do the bike lane, but we're also going to educate everybody about the changes that are coming, make sure they don't like cave to real estate speculation and sell their house and do all these wraparound things to stabilize the neighborhoods. Right. Then you can actually have things that improve property value and people can stay in place, right? Like the disinvestment, disinformation, gentrification cycle is well documented, and it has to be deliberately broken to actually make sure that the people that we're hoping to help actually receive the benefit from the changes that are coming.
important, so
I just
important.
wanted to say one thing quickly. So a previous organization I worked for, America Speaks, did a lot of work with Mayor Tony Williams in D.C. for 8 years. And he built it was called Office of Neighborhood Action, Office of Neighborhood Planning, Office of Neighborhood Services. And so there were 3 different parts of the government, but they had to work collaboratively on all the different parts of the city. And it took a long time to kind of stand up. They did a lot of great work, and people became a lot more engaged. And then, what happens in political life is the next mayor comes along,
right,
and those offices no longer exist. So, but I think a point that was made before is like, how do you institutionalize this? And how do you institutionalize it where it doesn't become kind of the next checkbox, oh, we now have to do this, this, and this. I see it as a kind of a strategic framework where it's like, what are the different tools and tactics and strategies we need for the particular situation? But it needs to be done, across the board in local government.
I couldn't agree more, and I'll pass on because I know we've got to move on. But I think that is the work, and I'm certainly committed to it. We have to institutionalize it, and I think so much of the frustration that the community has, and many of us have had, is that we're working against a system that was set up not to do that, right? And that's the whole tension. And so we're trying to break that down. I commend everyone involved, planning, Inspire, my colleagues, for wanting to do that work. It's going to continue to be important, and I think we've got a good start. And I commit, going forward through the implementation of Thrive and every other planning process and every other legislative process, that we can continue to improve that work. We're testifying now virtually. I am. We've had many people do that. We've done field hearings. I think there's other things we can do to systematize and institutionalize this work. So I appreciate that last point. Thank you, Mr. President.
Thank you. I'll just make a quick comment here. So much of this resonates on every conceivable level, and we have these conversations, but often in isolation and within the context of a budget line item or a project or a policy we're debating. Councilor Navarro's been, as all of my colleagues have been beating this drum on this in previous councils. And I think as a follow-up session, having a deeper dive more holistically across the board and how we communicate and factoring that into processes moving forward is where we need to go. And this body has made great strides. I'm proud of what we've accomplished, but there's always more work that needs to be done. So in a follow-up conversation, I think it would be worth having that broader contextual conversation and engaging other sister county agencies in that conversation, which I think is really important. So I'm going to be the bad cop here. So we've got 15 minutes left in a really important presentation that we are going to provide. I've got Councilmember Rice, Councilmember Katz, and Councilmember Friedson who are slated to speak. If we are not finished by 11:30, we will certainly make sure that we follow up with a second conversation, but I would again suggest that we have it within a broader context. But Councilmember Rice.
Thank you very much, Mr. President. And Councilmember Navarro has pretty much echoed all of the concerns I have. I'll just say this, that it embodies a simple statement. That is, we say what we want folks to hear when it comes to community engagement, but we don't want to hear what folks have to say. And it is something that is interesting for us because we sometimes go through the motions, right? And I think oftentimes we do that, but we already have predisposed as to what the outcomes are going to be and what folks are going to say. And even though they may say something different, we're like, okay, but you're the one off. And I still automatically know what your community is going to say, and therefore I'm moving forward with this, right? And so I think that for us, it is going to be that intentionality that we need to lead with, to say that we are open to hearing things that we don't want to hear, right? We have to be accepting of that and understanding that it is more than just us saying that we are great, we are terrific, we are doing the right things and doing right by folks, and understand that some of the things we do are not okay. I sit here as a black man who's grown up here in Montgomery County, and I know not all of the decisions, and I need to be reminded from folks in the community. When I look at Vernon Ricks and his wife, and I think to myself about how they've chimed in and said, Craig, listen, I know you think you know what you're doing, but let me tell you what is actually happening in the community. Those kinds of things are incredibly important. And I think that for us as electeds and for us as an embodiment of government, we have to make sure that we're ready and open to receive that. And then take a step back and pause and say, you know what? Let me rethink this, right? And that's hard. That is not easy. Just as you said, that is not easy. That is hard work to do because we've been doing this a long time. We've been involved, engaged, and I'm talking about a person who's in the community. But I know one thing, I am not the voice of the Black community. There are plenty of people who think and have experienced and view things differently from I do. And so I am not the sole lone voice in terms of what goes on in my community, nor am I the one with the panacea for my community as well, right? It takes all of us coming together to create that kind of understanding. And I think, Jordan, one of the things that you said when you said, look, we've got some of the people that are here, and this is what they're saying, and we've got some of the people that are here and what they're saying. And that's from folks that you reached out to. And that's what we experience. And that is the reality. That tells me that we're in the right place, right? Because that truly is what I see. You know, Councilmember Jawando and I have worked on some really tough issues together, along with the council when it comes to especially things impacting our BIPOC communities. And so it really is one where trying to achieve that balance and find it is incredibly difficult and incredibly hard. But I do think that we're now on the right path. I will just close by saying this because I know we're tight for time. When we go to communities, it is not just about going to a festival or an event and putting a table up. And I'm not criticizing because those things happen and those things are important. And those are seen as like the easy ways. Well, I'm going to be at the back to school fair and I've got it set up. But guess what? The majority of folks who go to the back to school fair, guess what they're going for? To make sure that they have school supplies that they can't afford. And so they're hitting every single table to get all that stuff to make sure that they can get that for their children. I'm not trying to talk to you about Thrive. And oh, by the way, let me use this as an opportunity because I work 2 jobs and I don't have a chance to actually play with my kids a lot. So I'm going to take them to the bouncy house and I'm going to get them the Slurpee, you know, because those are the things that we normally don't get to do. And so that's where my focus is. So at the festival or at the back to school fair, my focus isn't on Thrive. And yeah, I may talk to you and say, and nod my head and sign the sheet saying that I talked to you, but am I really paying attention? Because I just want that free thing that you have so I can put that in my bag and keep it moving. Yeah. And so that's the thing that we have to understand. We've got to go to these neighborhoods and have engaging conversations with them on their time, right? On their time that is convenient for them, not as a time that's slated for something else, right? I'm going to the grocery store, right? And you standing outside the grocery store, I want to talk to you about Thrive. Listen, seriously, I only have 15 minutes. I got to get back because I got to get to my next shift and I don't have time to talk to you about this right now. Okay, can you just sign this and take this pamphlet, right? Those are the kinds of things that, again, and we check a box and say, okay, we did our job, but we really haven't. That's not engagement. Engagement is sitting in somebody's house, right? And talking to them and saying, tell me about what it is that you want to see in your community, like you said, Jordan. Don't lead with Thrive. Lead with what it is that you want to thrive. Right. That's what it's about. So I think that, again, as we press the reset button, I think we can get there and get to that place. I don't think it's going to take a long time for us because we know we've already done it plenty of times in other situations. We can do it in this one too. I'm just sorry, brother, that you came in at this point and not earlier because then we would have had it done and we'd be ready to go. So, you know, it is what it is and we're going to still move forward. So I appreciate you. Thank you, Mr. President.
Thank you. Councilmember Katz, followed by Councilmember Friedson.
Thank you very much. That's a tough act to follow. I'll come on Sunday and hear you too. I was very impressive. First off, thank you all for being here and for doing this and for working with us. And you know, this is a topic like many other topics that people, especially in Montgomery County, have an opinion. I know that's hard to believe, but they have an opinion, and there are, in many cases, will come out faster if they disagree with you than if they agree with you. There are those who are, you know, the true advocates who will come out. And one of the things that we have to prove, and all the speakers before me have touched on this, is that we have to prove to people, show people, demonstrate to them that we really do listen to them and that we want to do what they would like us to do. This is for all of our benefits, not just one. You know, you were talking about the comfort level. Somebody didn't want to come and sit here and talk to us. I've always joked, I was the mayor of Gaithersburg for many years. I always joked that I could get as much done in the bean aisle, a giant, as I could at any meeting. I mean, somebody would say, they'd say, Sidney, you know, it's a good thing I bumped into you. There's a pothole in front of me. Now, that pothole, they didn't want to call me, but they would tell me there because they were comfortable. They knew me. And I think that's what we need to do more of. We need to, and I know we're short on time, and I'll try to be as quick on this one as I can, but this whole idea of engaging people who are in the community, who will speak out and show us what we've done correctly and what we haven't. And I'm going to give the example of Emory Grove's Pastor Tim Warner. I don't know if you've met Pastor Warner, but you should. And the Emory Grove years ago was really, it was a traditionally African-American community, and there was home ownership there. And the county government 40, 50 years ago, whatever, decided urban renewal was going to come through and change this, and they had a good heart with it, and they did an absolutely horrible job. I'm from that area. I saw it. The families that were displaced, and they said, oh, you can come back right after we build this beautiful, and they didn't come back. And now Reverend Warner has gotten, with his church, Emory Grove United Methodist Church, Reverend Warner has gotten people together that they're going to build. They've torn down what was there again and started over and going to have the right formula for this. But what we need to do is more of that. We need to say to somebody, tell us what you want. We will let us work with you. We're going to have to figure out how to do it. We're going to have to figure out how to fund it. We're going to have to figure, there's a lot of figuring out that has to be done, but we need to do it with people who are in the community, who are going to stay in the community, and who will face people every day. And that's what it's going to take. And so the only other question I have, and I know we're almost finished here, but the only other question I have is when you looked at the various population areas, how large did the population area have to be before you said that was an area that was you needed to discuss things with? You know what I'm trying to ask?
Yeah. So the calculation is based off of like the census data. So it looks at the local population and it identifies the tracts where certain metrics are met. So I think probably what happened is that we actually captured more people than fit exactly that target demographic, but we cast a wide enough net to make sure the communities that had significant proportions of low income, people of color, they were targeted. And that target demographic is where we did, our postcard mailings and, some limited, canvassing and pop-ups and things of that nature, where we know just from, knowing the community, this is where, folks live, right? So, yeah, that's kind of the best way I can.
And the only other thing, and I'm going to stop, but the only other thing I did want to point out is that Thrive 2050 is not involved directly in the municipalities that have their own zoning and planning authority, Gaithersburg and Rockville, which is my district. And there are people, though it certainly is going to affect them, whether I live in Gaithersburg, but it's going to, I'm outside, it's certainly going to affect us. But there is confusion on that someone, and of course, you have people with a Rockville mailing address that don't live in the city of Rockville, so then it gets that much more confusing. But people do need to understand that the municipalities themselves are not covered under this legislation or potential legislation. And with that, I'll turn back to you. Thank you all very, very much.
I'm wondering if I could just, one of the things that you said about the urban renewal that happened, we heard about that several times in the focus groups. We had in two different focus groups, we had members there who their families had been disrupted. They lost their homes, they lost their property. And at the end of every focus group, we talked about the issues around integration and, institutional reparations. I really think it's important that the council, the planning commission really think about how do we really counteract kind of the legacy of the racist past. That's something every community is struggling with. But what does it really mean to undo that, right? How do you go about doing that? But that was a fundamental question that came out of most of the focus groups.
Yeah, and I'd just like to add, I think it's really important the distinction you made about the intention, right? Like the intention was good. In planning school, we learn about all this stuff. Like they had good intentions when they built the projects. They had good intentions when they did urban renewal. A lot of these things that we do that are designed to address these issues, they're experiments, right? And the problem a lot of times is the follow through. The devil's in the details. And I think good intentions is not enough to get the outcomes that you want. And the more I got into this, the more people I talked to, the more I read and reviewed the plan, I had to ask myself that question: is this urban renewal 2.0? Like, is this going to, in fact, do the displacement that everyone's afraid of and create this balloon effect? I mean, where you just squeeze people and they end up going even further out. And I think we're not going to have time to get into recommendations today and the plan chapter itself, but I think one of the biggest challenges with this kind of work is, like, we all want the place to thrive economically. You want new jobs, you want these things, but where those people live that do those low earning jobs, we talk about sustainability, but if everyone that works in your retail establishment, your coffee shop, et cetera, is doing a 2-3 hour commute in because they can't afford to live close by, it really doesn't matter if the people that live close by are driving Priuses, right? And I think that reality needs to really be reflected in this work, because it's almost as if the plight of those people in a lot of these planning documents is invisible, right? Like, yeah, we're going to all be good urbanists and take the train, but the guy who cuts my grass lives an hour away. Like, it doesn't add up, right? And so we have to think about that as we plan to say, maybe the idea of housing for the local workforce needs to be the priority. Like, everyone that works in this area should be able to live in this area. That should be a mathematical possibility.
I mean, you very rarely see anybody carrying a 2x4 on a train. Right. I mean, that's the reality here. And as much as we all should be using the train as much as we can. So, anyhow, thank you again, Mr. President.
No problem. Thank you. So, Councilmember Friedson's going to close us out here and make a comment and maybe ask a question in 4 minutes or less. But there will be a part 2. We are going to work on that as soon as possible and bring you all back. I know there's a lot going on here, but we need to continue this conversation. It's really important. Councilmember Friedson.
Okay, well, first of all, thank you. I mean, this is a really important conversation. I'm glad we're having it. I'm glad that you have done the additional work, and I'm glad, as we had talked about before, and I had specifically talked about both in our public conversation and some of the subsequent one-off private conversations, that we really need a roadmap here, and we need processes, and engagement isn't something that has a beginning and an end. It's an ongoing, evolving process, and so I do think it's important that as we have this discussion and these conversations that you had and the recommendations that you're bringing forward, that we also talk about this not just as the document that's before us now, but as the way in which we do the work that we do, as Councilmember Navarro has talked about, as Councilmember Rice has talked about, as every colleague has really reflected. I don't have a movie to reference, so I'll reference Aristotle. Aristotle said that we are what we repeatedly do. That's culture. Culture isn't what we say, it's what we repeatedly do. And this is a conversation about not just what we do, but how we do it, is another way of saying exactly what he had said. And Jordan, you had mentioned that earlier. And I do think, what we are talking about here is a total paradigm shift for the way in which we do planning and the way in which we do government. And that is an ongoing, evolving process that we are not going to be able to resolve on one individual topic. We're not going to be able to resolve in one individual aspect. That's why the work that has been done up to this point, the work that continues as we move forward, it has to be institutionalized. It has to be moved forward in a very intentional way. And I think your work will help us move that forward. And again, it's not just about planning. It's really about everything that we do. And you spoke a lot about some of the challenges and issues. I will say a lot of this has to do with trust. And we have work to do to build trust. That's not a planning issue. That's a public sector issue with the communities that we serve. That's an institutional issue that we have to do better. And that is a process. You don't build trust in a moment. You build trust by slowly thawing some of the distrust to a point where you rebuild it to where it needs to be. So, we talked a lot in this, and the report that you have presented us talks a lot about reactions, and I think that's really important. But we also, as we do this work, have to go deeper into why those reactions were there. What is at the core of that distrust that makes someone feel that when you say this, what it means to me is that, which are two different things. And we have to do a better job of really thinking through that. Are you concerned about what we're talking about here? Or is there something deeper in that conversation? I think that speaks to a lot of what colleagues have mentioned here, and I think it speaks to what you had mentioned. I will note, I think it's very interesting. We talk about differences, but both white respondents and BIPOC respondents noted environmental sustainability and a strong economy and jobs as top priorities. So I think that's really important. There are a lot of similarities of what people care about, what they want for their families, what they want for each other. They just are in different places at certain points, have different perspective, different lived experiences, and I think that's really critical. I think adding those two chapters is going to be important to speak to those concerns. So I'm glad we are moving some of this forward, and I am pleased that we have a schedule to take this up. I do think that doing nothing is not an option. As was said before, we have to move forward. We have to continue to do better. We have to push ourselves and make sure that we don't allow where we know we are coming up short to allow us to shirk our responsibility from doing anything, because we have work to do. And I do think that we have continuous improvements that we need to make. And the key is that we institutionalize the changes that we talk about here and that we build from them. I would guarantee that even in the DC example with Mayor Williams, a great regional leader, that if you did some of the same focus groups and the same conversations in DC, you get a lot of the same answers. And we do have to have a lot of these conversations about chronic disinvestment and displacement, and make sure that we are talking about what those means, because some of the challenges in Montgomery County aren't just necessarily about displacement, they're about chronic disinvestment and what has happened to parts of our county when we've fundamentally ignored them for long periods of time. And so the work continues, the work remains. Your work is really critical to that effort. I really appreciate that, and look forward to us taking up these issues, working our way through it, and continuously moving forward on what needs to be an evolving process, but that is repeated, because there's no such thing as culture without repeated action. So thank you very much.
Thank you. Spot on comments, everyone. So we will follow up. We will have that broader context, and we will work aggressively to meet the timeline that has been set forth that we've all agreed to as well. A lot of work to do, but this is obviously a critical document. Thank you all very much.
Thank you.
All right, we are now going to move on to the next item on the agenda, which is the consent calendar. Can I get a motion to accept the consent calendar?
So move.
Moved by Councilmember Katz, seconded by Councilmember Rice. Any comments regarding the consent calendar? Seeing none, all those in favor, please raise your hands. And that is unanimous among all those virtual and present. That takes us on to the next item on the agenda, which is a celebration. This is a commemoration celebrating African Heritage Month by myself, as well as Council Members Jawando, Rice, and our entire council. Just to quickly go over the run of shows so we know what to expect. We are going to first hear remarks from Thank you all very much. If you all could take those conversations outside, please. Great, thank you. So what we are going to do is first hear some opening comments from myself and Council Members Jawando and Rice. We will then see a beautiful video segment. As soon as the video segment's over, my colleagues will have an opportunity to provide reflections. And then we will convene in the front of the dais here for the reading of the proclamation, followed by presentations given by select groups in the audience who hopefully know who they are, but will be introduced by Council Members Jawando and Rice. So thank you all again. So I have a prepared statement. Before we break for recess, we have one more presentation. And as you know, I'm incredibly proud to live here in Montgomery County. One of the most important reasons that I am proud to be here is the rich diversity of the community that surrounds us, and one that I have benefited from personally on every level. The diversity brings with it a myriad of experiences, traditions, ideas, stories, food, and art, which serve to enrich all of our lives. Montgomery County's strengths, I believe, and I believe many of us here do as well, is truly derived from its diversity. So it should be no surprise that the Council has made it a strong tradition of its own to celebrate this diversity and showcase just how incredible a place this is to call home and to build a home. So today I am excited to begin September with Council's second consecutive commemoration of African Heritage Month, recognizing and celebrating the contributions of individuals who have brought aspects of African culture to our county and our nation. The African diaspora makes up 15% of the county's immigrant population and represents the languages and cultures of 54 different countries. The diversity and rich cultural traditions that the African community brings to Montgomery County and the nation is an essential part of what fortifies our collective vision of prosperity for all. There is no better way to highlight the African influence in Montgomery County in the U.S. than to introduce you to members of the community who exemplify the hard work, perseverance, and success of this community in the county. So today, after comments from my colleagues, we will be showing a short video segment created to showcase African art, dance, food, music, and traditional attire. For the arts, we are featuring Emmy-nominated musician Sheikh Hamala Diabate from Mali, dancer and artist director Michael Friend, and Ethiopian painter Solomon Asfal. For food and culinary arts, Egyptian chef Iman Musa, Gambian chef Hatib Juf, and food historian and writer Emily Deach. And finally, we will meet Nigerian fashion designer Usayo Shitu to discuss the inspiration behind her work. I would also like to thank my colleagues on the council staff, specifically Joe Thompson and Mershai Salou, for the incredible work they do producing these segments and make it possible for us to share these stories with you today. So with that, I will now turn it over to Councilmember Jawando to make some opening comments, followed by Councilmember Rice. Councilmember Jawando.
Thank you, Mr. President, and good morning, everybody. It really hurts my heart that I'm not physically there with you. I don't know if it was said before I joined this morning, but I tore my Achilles over the weekend. And in some pain, and also not mobile. So, but thank goodness for the virtual technology allows me to be there. I'm really happy about that. It reminds me of the African proverb: if you want to go fast, go alone. If you want to go far, go together. And I appreciate the opportunity to be together with my colleagues in this format to honor African Heritage Month. I had a whole outfit planned. I was going to run it by the Nigerian designer and see what you thought, and but I'm going to have to save that for another day. But really excited that we're doing this. Montgomery County has a really strong history, as Council President mentioned. 14 years of being the national leader of declaring September African Heritage Month. We have a whole month of activities. Panifest is coming up. There's just so much going on, but I'm really proud that at the council we took the step in this council for the first time to officially recognize and have this celebration last year. It's important. Our great diversity is our strength. It's also, as the previous conversation points to, is something that is a opportunity and a challenge for us to make sure we're living up to ensuring that everyone has the opportunity to thrive and use their full God-given potential here in this great county. Certainly, my story, my dad immigrated here after fleeing a civil war in Nigeria and found his way to Montgomery County, like so many African immigrants have done for generations. And however you got here, we are a large, diverse Black community, an African immigrant community, and it's just such a great community, and a great, at any given night in our county, you can have something going on that's a cultural festival or important meeting here in the county related to African immigrants, but also so many others. And so it's really an honor to be here and highlight with my colleagues some great innovators in the second fastest growing, one of the fastest growing immigrant populations in our county, and really appreciate all the work that has gone, as was mentioned, by our staff and by Merkai and everyone on our team to uplift this community and show some of the great things that are going on. So thank you, Mr. President, and turn it over to Councilmember Rice.
Well, thank you very much, Councilmember Jawando. And I'm going to be brief because I really want to get to the program and hear from some of the individuals in our community. I'll just address the elephant in the room. Yes, I do have braids, and I think, yes, thank you. I love it. And it's interesting as Councilmember Jawando talks about heritage. In tradition, it is oftentimes that in African culture and heritage, when you are embarking on new and momentous times, you actually change your hairstyle. And so as I transition off of this council, I certainly want to make sure that people understand my dedication and my commitment to my African heritage. And I'm looking forward to hearing from Jake because I know my ancestry DNA. I know where I come from, and I know I come from Mali. And it is important for us that we continue to destigmatize all of the things that are associated with African culture and heritage. The simple fact that a person may wear a dashiki or wear some African clothing does not mean that they're trying to make a statement or they're trying to do something, or that a person that has braids or dreadlocks in their hair that also evolved from Africa. Just look up our great Emperor Haile Selassie, and you'll find out a lot about dreadlocks and where they actually originated from in Ethiopia. But it's all of these kinds of things that I think is important for us to make sure that we're reminding folks when it comes to celebrating heritage and realizing that if we are true to accepting differences, if we are true to saying that we don't treat people differently because of where they come from, how they look, how they speak, then all of those things that are different are just different. And there's nothing else that changes anything about those individuals because those things may look or sound or appear different. And it is incredibly important that we also recognize the great entrepreneurial spirit that we see, and that's why I'm so happy that the folks that we are honoring today are all entrepreneurs in their own right, because we know how strong our immigrant population has always been. In fact, we know the great work and the strength of Africans when it came to dedication. It's the reason why they were stolen from their country. You don't steal labor if you don't think that it's going to be good labor. Folks knew about the ethic that we had when it came to work, which is the reason why we were stolen from our continent and brought here to the United States. So it is no surprise that the folks who immigrate here are very hard workers and continue to strive to be successful in their own right. And so we'll be highlighting that today. When I had the opportunity to go to Gondar, Ethiopia with our sister city trip, I got to see that entrepreneurial spirit firsthand in Africa. I got to witness the great work that continues, and it inspired me. It inspired me because it is incredibly important for us to continue to raise awareness when it comes to some of the challenges that we put before our immigrant community. Making sure that we continue to lift up their culture while at the same time ensuring that they can continue to be successful in their own right. And it's one of the reasons why partnering with our Department of Agriculture, setting up our immigrant farmer program so that we can ensure that so many who are so strong in their own home countries with agriculture can do the same thing and take advantage of the agricultural reserve that we have right here in Montgomery County. You know, Africa is the second largest and second most populous continent in the world, and 15% of those immigrants from Africa call home Montgomery County. And I think that the rich culture and diversity of languages that we see, the traditions that we see, all make us incredibly fortunate as a community. From art to music to dance to food and fashion, it really is the things that enrich our understanding of what it is to have a diverse community, and one that represents our African community and how much it can continue to share with us. So with that, I'll turn it over to our folks to run the video, but do want to encourage you to make, I'm sorry. I'm sorry. I'm going to turn back to Council Member, to Council President. I'm sorry.
No worries.
But did just want to say in closing that I think that it is incredibly important for us to make sure that the opportunities that we have to continue to bridge more connections with Africa, not just with Uganda or Ethiopia, but with other countries throughout Africa, is something that will benefit our community and Africa as a whole. So with that, back to you, Mr. President.
Thank you so much, Councilmember Rice. And I'd be remiss not to acknowledge the incredible work that Councilmember Navarro has done as the first immigrant to serve on this body. She uniquely understands what we're about to talk about in this video, and so it's more than appropriate to have her speak before it starts. So, Councilmember Navarro.
Thank you, Mr. President. It's such an honor, and I'm really filled with a lot of emotion because this will be my last commemoration here, sitting on this dais. But I just wanted to say a few things. One of the things that inspires me the most when we bring together the African diaspora to this chamber is the fact that, to me, this is a representation of unity. A lot of times when people talk about Africa, they seem to refer to it as if it's just a country. It is a vast continent with extraordinary history, with different languages, different tribes, different history, different traditions. And it is so important not to reduce it to just that one sort of label, just as many of us who are immigrants, when we come to the United States, all of a sudden we have to learn all these new labels, right? So when I came to the United States and I realized I was going to stay, all of a sudden I was labeled Latina. And I always have this conversation with my daughters about what it means to really be a representation of so many different cultures and ethnicities, you know. And speaking of I'm always fascinated by this whole thing about, you know, genetic breakdowns and everything like that, and I always get these updates. And so the last update had Cameroon, Congo, Western Bantu peoples, Nigeria, Northern Africa, Benin, Togo, and Senegal as part of my DNA, because I am absolutely a total mix of what it means to be a Caribbean, Latin American person, having indigenous blood, having African blood, and having mostly Iberian Peninsula blood. And my husband, of course, is from Haiti. So our daughters, we had to raise them understanding that as human beings, we are very expansive, and that we don't have to be put in a tiny little box, but we can absolutely embody all of these different extraordinarily powerful civilizations within us. And so to me, that's been very important, and it has guided my work. And I want to thank some of the people in the audience, you know, who I've had the opportunity to work with very closely. I see Jerry Bande, who is an extraordinary asset to our county. Fatmata Berry, who has been amazing as a woman leading in so many areas. Danielle Karoma, Mashur Salu, right here in our own council family. But I do want to take a moment for a point of personal privilege, and I want to congratulate my Chief of Staff, Ikad Ikeloa, also known as Roland. Stand up, Roland, stand up. Because Roland Ikeloa, who hails from Nigeria, just received the James Curry Society's Lifetime Achievement Award from the African Studies Center of Oxford University for literary criticism. So he's not only my Chief of Staff, a friend, but he is a renowned person throughout the world in his extraordinary work in literacy and in literature. And, you know, to me, it just speaks to who we are in this county, right? That we have such wealth of extraordinary talent, and so many people who come from so many different places come here and choose public service and choose entrepreneurship and choose so many different things. And indeed, it is what makes this place such a magnet for so many and why we have such high quality of life. So thank you all. Thank you, Council President, Councilmember Rice, and Councilmember Jawando for continuing the tradition and for really having an opportunity. I also want to say I am so sorry I can't join you for lunch. I have a doctor's appointment, but I'm sure Roland will pack me a little plate or something because I was looking forward to the food. I know he's going to eat it all. Thank you.
Thank you so much. All right, let's air the video.
The United States is home to a thriving African diaspora that has made important cultural contributions. Each one of us has a different story, but we've all come to call this nation our home. I'm Mirshai Salu, a Montgomery County resident originally from Ethiopia. In this African Heritage Month, I take you on a journey to explore the influence African fashion, food, music, dance, and art has had in our county and nation overall. According to the Migration Policy Institute, as of 2019, there are over 3 million African immigrants living in the United States. Most of us leave our countries for familial ties and economic betterment. With us, we bring our diversity, talent, colorful clothes, flavorful food, and vibrant music. And with the rise in African immigrants, the African culture has become more prevalent and global. We start with fashion. Over the last few years, the demand for African attire has soared. We no longer have to look for festivals to get African clothes. We've seen stores sprouting in malls all over, making getting our hands on the colorful fabrics a lot easier. Busayo Shitu is a Nigerian-born fashion designer and owner of Bibire, a clothing line specializing in African attire. She knows that her pride for her culture and heritage is something that she'll never lose, which has led her to what she does today.
Bibire, it actually is huge. It means when you're born into wealth. If you've been born good, of good heritage, you can't use money to buy good heritage. You have it and you have it.
When Busayo first started her business in Germantown, she mostly had African customers. But over the years, she saw her customer base becoming more diverse and noticed the mounting excitement for African fashion in the community.
If there's ever a need or a moment to be proud to be African, this is it. The movie Black Panther came out and then people are like, wow. And people are now finally realizing that, oh my God, Africa is not just this poor continent. They started looking at the fashion and they're seeing designers come from Africa and design fantastic things. When I went to New York Fashion Week and we used African fabric, the ashoke, and people are like, what? This is from Africa? Yes, it's from Africa. So people really are feeling Africa right now. And I feel like in a few years' time, you probably go to Macy's and you see African dresses there.
African food is another area that has gained popularity over the years. African cuisines have been developing from home cooking to a more modern approach by chefs who are working to bring in new techniques that are adapted to traditional fares. This approach has helped African food find its place on the world culinary stage and shape American cuisine.
Marinate the steak.
Hatib Diouf, a Gambian native, is determined to introduce West African flavors to his community with some improvisation and adaptation. He invited me to his kitchen to learn how to make chu, a West African delicacy.
We have a very, very rich culture, and our hospitality and our food is vast. Africa as a continent is bigger than the US. I always talk about that. We also have a very, very rich cuisine that, when you try it, you become used to it and like it. We do use a lot of natural stuff. Tamarind, sorrel, which is hibiscus, which I incorporate in my baking just to Africanize the desserts that I offer in-house.
Hatib opened his restaurant Masakunda in 2019 as a solution for the West African fine dining experience the region was lacking. And Tacoma Park gave him the sense of home he was searching for.
There is no other place in this world that I would have ventured this establishment. This is the place that I know that is diverse in culture, that people here are very, very curious. If I had to do it again, this is where I would open the store. What I was looking for was a place that can actually harbor my business. But what I found is a locality that actually resembles where I come from, the sense of community.
In addition to the food he serves, Hadib also wants to introduce the African culture through the many custom-made artifacts he handpicked from his homeland. His goal? To transport his customers to Africa for a full West African dining experience.
Everything here actually has a story, and because I wanted to create a place that I would call modern Africa, a place that represents the continent for what it is now, what has been portrayed.
African food is as diverse as its countries, and this immensely rich diversity makes African cuisines unique from region to region. Iman Musa, an Egyptian restaurant owner specializing in koshery, Egypt's national dish, noticed that there wasn't enough North African cuisine representation in the area. So, she decided to do something about it.
I decided to name the brand after the traditional dish because I wanted people to know what koshery is, and I jokingly tell my customers now when you ever land in Cairo, you know what to order for yourself. But the origin of the word is the khichdi meal, which is an Indian meal, and this is a piece that I was very happy to discover. This meal traveled from India to England, and then it went to Egypt, and a lot of modifications happened to it and became the koshery bowl.
Iman has seen her customers find a familiar taste in the dishes she prepares, which she thinks has contributed greatly to the popularity of African cuisines.
African food is on the rise, very popular. Egyptian food is now on the rise. We have several now Egyptian spots around the area. It used to be only New York. Now they're spreading out a little bit and other states around. So it is on the rise. People are realizing that those are very familiar flavors. The restaurant owners are breaking this fear of, oh, no one knows what Egyptian food is, so I'm not going to make it. And they're starting to introduce it to the market. So I'm really optimistic.
To understand the origins of certain African dishes like the koshery, which was brought from Asia to Europe and then to North Africa, I met with food historian and writer Emily Deach, who spent decades studying African cuisines.
The story of African cuisine is the story of what was there originally, what came through colonialism, what came through immigration, refugee situations also, and modernization and globalization.
Emily explained that although each of these different countries have a distinct cuisine, when it comes to the broader regions of Africa, there are still lots of commonalities due to the environment and cultural influences.
There are 54 countries in Africa. There are countless languages. Of course, it's not a monolithic cuisine, right? There is just diversity everywhere. In the north, you have countries, most people know, say, Morocco and Tunisia, heavily influenced from French colonialism. So you have some of the French names for dishes, classical French techniques, and so on, but then also Middle Eastern influence with the spices, with the kind of stewy dishes. That's where you get tagine, that's where you get couscous, and it all kind of commingles together. On the east, you have more Southeast Asian and Indian influences. South Africa is probably the biggest hodgepodge because it was Dutch, English, some Portuguese, some French, also Indian, So that's where they get their curries from. And then West Africa obviously has huge influences from the Caribbean, from Portugal, from those kind of the triangle trade between West Africa, North America, and South America.
African flavors have always had an influence on American cuisine dating back to the slave trade. This influence is even more widespread today, giving it a more prominent place.
I think for a long time, because of our social history as a nation, it wasn't seen. Something that was produced, for example, Thomas Jefferson's, all of his cookery that's considered American food was designed by his African-American cook that had so much African influence in it in terms of the dishes that he saw, but it was kind of considered or received as American rather than from African heritage. So I think there was a long history of it being influential but not seen.
Wherever there is African food, there is African music. Africa boasts a rich landscape of musical styles. From west to east, north to south, the African musical influence spans beyond borders and has been shaping music in the US and around the world for centuries. Shikamala Diabate, a Grammy Award-winning musician from Mali, has made it his mission to explore the connection between America's traditions and his own griot roots. Over the course of his career, he's connected the musical instrument similarities between the two continents.
When we talking about the banjo, American banjo came from the Goni. That time when I first came to America, they hear, because they already know the Goni, and they know the griot people play Goni. Many people, the African music have a lot of power in America. So African music influence now all the world is a many strong, lot of power. Anywhere you go is African music. Many things, even the blues, all came from Africa.
African music calls for some dancing. Preserved and passed from generation to generation, these dances have remained as rituals and spiritual traditions, creating a basic vocabulary of movement common throughout the entire African diaspora. Michael Friend, artistic director and founder of Soul in Motion African Dance and Drum, has dedicated his entire career to making the cultural connection between America and Africa.
It's my mission, and it's the organization's mission, really to sort of morph the lineage of Africa into who we are as African Americans, and understanding what that means. You know, born in America, but you identify with the lineage from Africa. In our performances, what people see is they see a morph of understanding what they, the cradle of civilization, the African connection through our performance, what we bring to it as African Americans, which is just a smelting pot of all these different identities. So our inspiration is that of Africa, West Africa specifically, but we want to be able to identify ourselves in that as well. So people really get a sort of this morphing of who we are, who we understand is our background and our inspiration going forward.
Through his band's performances and their drums, Michael's goal is to teach the youth about their African heritage so they know where they're from and where they're going.
The idea of the dance and drum when we go on stage is very important, especially for young people, because we want them to understand sort of that connection, that power they carry just in their culture and their ethnicity. So it really helps to connect the dots. So I think for dance and drum, that's the vehicle by which, through the music, through the arts, that we get there. We lead the charge.
To experience Africa is to understand history and resilience. And no one expresses that better than a painter. In the heart of downtown Silver Spring, I visited the studio of Solomon Asfaw. Solomon, an Ethiopian-born painter, was inspired by the colors and surroundings of his home country. He's always wanted to tell his country's untold stories through his paintings.
I grew up at in the church, so growing up, watching those kind of paintings, iconographic paintings. And I don't remember even when I started painting, because since my childhood, when I used to paint, the slums, the shanty towns, the old roofs, the electric poles, and the hustle and bustle things, that crowdedness, the dirty things, that muddy things, I see colors on that things, and also stories.
That's the hustle and bustle you were talking about.
The hustle and bustle, yes, you're right.
After he moved to the U.S., he expanded his work to include elements from his new home, hoping to bridge the gap and connect his East African roots to American traditions.
When you travel, when you go anywhere, it's still with you. So you add up something into it, and it's kind of fusion. So also that creates something beautiful.
Solomon sees a promising future for African art and artists, which he says has become more seen in the last few years.
The time is for Africa, right? So now the African art becomes like the music, the art is booming. The people are watching, and a lot of collectors are interested and buying artwork, and these artists are becoming, well known in big banners and big art shows. You see now a lot of African artists from Nigeria, Ghana, Ethiopia, all over Africa.
We continue to share our stories, from the clothes we put on our backs, to the kitchen of our homes and restaurants, to the music we listen and dance to the canvas that reflects where we've been and where we're going. Our culture lives on in the people who work every day to preserve our African roots.
That was amazing. The quality of these videos, I'm telling you. I mean, I'm starving because the food was like jumping off the screen. So great job, Michelle. Great job. So we will now hear from colleagues who will make brief remarks. I'll remind everybody that the only thing standing between us and some of that delicious food is the rest of this presentation. Wow. So please keep our comments brief, but we're going to start with Councilmember Katz.
Thank you very much, Mr. President. I heard you loud and clear about food. Really, what a wonderful video. And I noticed that Joe immediately turned to you and pointed to you, which he should have, but Joe deserves a round of applause as well. Today is just another example of why Montgomery County is a blessed place. It truly is. And I'm someone who is a third-generation Montgomery County resident. I've never moved more than 3 miles from where my parents were living when I was born. But I thank God literally every day that my grandparents came thousands of miles from Lithuania. It was on both sides. My grandparents from both sides came thousands of miles from Lithuania to get us here today. And many, when they left, and they certainly did not have a good life in Lithuania when they left, many of my family's relatives, who I really did not know, ended up in South Africa. But I am proud to say that one of my mother's cousins was appointed to the Supreme Court of South Africa, and to make that even more impressive, he was appointed by President Nelson Mandela. So I am truly honored to be with everyone today, and I'm truly realize how fortunate we all are in Montgomery County. It's important that we celebrate our own culture, but it's probably more important that we celebrate our neighbor's culture as well. And you can maybe look at me and tell that I enjoy the music, and you can maybe look at me and tell I enjoy the festivals, but you certainly can look at me and say that I enjoy the food. And so I'm going to stop this. I'm going to stop speaking so that we can actually get to something that I truly also enjoy. Thank you very much for all that you do for Montgomery County. Thank you.
I also want to note Congressman Raskin's district team is here. Kathleen Connor, thank you so much for representing Congressman Raskin today. Next, we will hear from Councilmember Reamer.
Well, thank you. That was an amazing video. The quality was spectacular. The food, I could almost taste it. I could imagine how it could taste. And I'm overdue on a visit to Montgomery, which is in my neighborhood, and I want to get back there soon. I'm just so happy and grateful to be able to live in a community that has so many people from so many different parts of the world. And the African immigrant community is a big part of my neighborhood and my schools and the community that I love and cherish. And my sons, as everyone who's a parent knows, when your children's friends are part of your life, and they're in your living room when you come home at the end of the day, and they come over on the weekends. And many of my sons' best friends are children of African immigrants. And I enjoy that relationship and learning and sharing. But the community also holds me. And I want to thank Jeru for, after I was injured, I had a very significant injury a number of years ago. And because I had traveled to Senegal and to the Gambia a number of years ago, I had a chance to share some of that experience with Jeru. And after I was injured, he came and he brought to me a dinner of yassa chicken. And that was a moment for me that made me feel just so supported and cared for and held not just by Jeru and his wife who prepared the meal, but by the whole community. And I think that is what makes this county so special, is the way that the communities are strong and work together to make all of our lives better. And it was just a moment and a small example, but it's something that it's every day, and it's in so many ways. So I'm really pleased to be able to celebrate today. And again, I want to thank everyone who has been part of this celebration today, but again, express my appreciation to be able to live in a community that again, brings together people from all over the world and makes something so special and so enjoyable to be part of. So thank you.
Thank you. Councilmember Harker.
Great job, Merche, on that outstanding video. It's a great honor to be celebrating African Heritage Month with all of our my colleagues and all of our honored guests. I can just tell you how much personally I enjoy representing Silver Spring for 16 years in the General Assembly and in the County Council, and working with good friends like Jeru. Every year I learn so much, and I really enjoy working with so many residents on individual concerns like small business grants and rental assistance and tenant concerns. We've been talking about food and art and music, but I also just wanted to recognize and thank so many of you for fighting for not just a more culturally rich community, but a community with greater protections for people who really need it from their county government. I've worked with some of you in this room for Ezekiel's law to stop toddlers from falling out of our apartment windows recently, to pass the Body Camera Transparency Act after one of our 5-year-olds was abused by a couple of our police, unfortunately, in East Silver Spring. And of course, with Councilmember Branson on an employment non-discrimination law last year. So many of you have been such great activists to give us a stronger community, and so many of those laws have been written by Livu and Ludine, and managed by Selena. So thank you all for your contributions too, because we all celebrate our great cultural heritage here, but you all have given us stronger, lasting protections as well by working so closely with me and my colleagues, and that's a real honor, and I greatly appreciate all of your contributions in that area as well. Thank you so much.
Thank you. Well said. Councilmember Friedson.
Well, thank you so much. I am so thrilled to be part of this incredible celebration. Really appreciate your leadership, Council President Albornoz and Council Members Joando and Rice and all colleagues for putting this together. Thank you to the team. Thank you to Merche and everybody. Our county is stronger because of our African immigrants. This council is stronger because of our African immigrants who are part of our family, who who are part of this team and part of our community. We talked about culture earlier this morning quite a bit, and there's another saying about culture that to understand the culture, study the dance. To understand the dance, study the people. And that's true of dance, it's true of art, it's true of food, it's true of music. Today we're talking about the people who make all of this culture possible. And in many ways, it's not just a celebration of the African diaspora, which is so rich here in Montgomery County and in our broader DC community, but it's a celebration of our community itself, who we are and what we value. Your values are our values, and in so many ways, your culture is our culture. Even the aspects of our culture that we don't even think about are really yours, that we have borrowed and in many ways taken, and don't give enough credit. The banjo, as was talked about earlier, but it's more than the banjo. It's the food, it's the music, it's the fashion. It's so many aspects of what we view as ours is in many ways yours. And today is a celebration to, in many ways, reclaim what is yours and thank you and express our gratitude for everything that you mean to enrich the fabric of what makes Montgomery County such a special place. Your entrepreneurial spirit that we're celebrating in many ways, and the culture that really is part of that vibrancy and that dynamism. I was at the Ethiopian Day Festival recently, a couple weeks ago, with many friends who are here today, and I can't think of a better celebration of what makes Montgomery County such an incredible place. The culture that we saw, not just in the booths on display, but in the crowd of thousands and thousands and thousands of people descended in Silver Spring at the Civic Plaza. It was why we build Civic Plazas, literally, in that moment there. So I'm just so proud to be part of this celebration, so proud to consider you friends. Jeru was mentioned earlier. Jeru is my personal food consultant. We go around Montgomery County, and he shows me all of the places I haven't yet tried and need to. And so I appreciate that, appreciate all of you, and look forward to this great celebration. I've got to say, I'm hungry watching that video, as colleagues are as well. So I'll yield back to you, Mr. President.
Thank you. I am too. All right, colleagues, we're going to gather in front of the dais, read the proclamation, and invite the guests who are going to make presentations of their own after we read the proclamation. All right. This is in alphabetical order. So, Proclamation of Montgomery County, Maryland. Whereas September is African Heritage Month, which recognizes and celebrates African achievement and educates community members about the many cultures across the African diaspora. And whereas
Montgomery County is the first county in the nation to proclaim the month of September as African Heritage Month, as we should be. And
is it my turn, guys?
I think I'm after Friedman. Whereas with 54 countries, all with different cultures, languages, dances, and rituals, the African culture and identity is vast and diverse. And
Montgomery County is home to a large African population, making up 15% of the overall immigrant population in our community.
Whereas we recognize African community members for their ongoing achievements and their contributions to our county's diversity with their traditions, values, and history. And
whereas the Montgomery County Council's second annual African Heritage Month commemoration theme is the African influence in Montgomery County and the United States. And
whereas this year's commemoration highlights the influence that African art, dance, fashion, food, and music has across the nation and within our community, and
whereas during this African Heritage Month, we not only celebrate the culture of Africa, but we also learn about its history to understand where it all began. And
whereas we recognize the rich mosaic that is celebrated during African Heritage Month as a way of preserving the past, linking to the present, and educating future generations.
Now, therefore, it be resolved that the County Council of Montgomery County, Maryland, hereby proclaims September as African Heritage Month, presented on this 13th day of September in the year 2022.
Okay, I got it. Please.
Great. And now, Councilmember Jawanda will introduce our speakers.
All right, here we go. And I'm glad everyone came up to the front so I could see people. Thank you for doing that for me. Our first speaker, and we have a couple that come forward. I know Councilmember Rice will be a part of this as well. Dr. Michael Mills, the Vice Chair of the Montgomery County Sister Cities Program. And we also have Fatmata Berry, an attorney and newly minted Chair of the African Affairs Advisory Group. And when she was slumming it, a former member of my staff. But really proud to hear from both of them, and appreciate each of you to bring brief remarks in that order.
Good afternoon, everyone. On behalf of the Montgomery Sister Cities program, it's my honor to celebrate African Heritage Month. We do a tremendous job with Sister Cities celebrating the heritage, as Councilmember Rice spoke earlier about our trip to Ethiopia. It was just a reaffirmation of what we need to do as a people to support our African family, and it's just a pleasure to represent Sister Cities. So thank you.
Thank you, everyone. Thank you, Councilman Jawando and the wonderful council. I want to say thank you to everyone for being here. African Heritage Month obviously represents and speaks to us as an African people in this county. As the second fastest growing immigrant population, this is a real honor. And I want to take the time to thank our county executive for making the third Saturday of September Pan-African Festival Day over at the Civic Center. So every year now we'll be having it there on the third Saturday. And I want to take the time to give a special thanks to Councilman Jawando, to our own first immigrant ever represent us on the county council, for the advocacy and the fight for us to have our own liaison for this huge continent in this county. And I want to introduce our Vice Chair. She's my Vice Chair for the African Affairs Advisory Group, newly minted, Mona May, and to recognize the two first representatives for the African Affairs Advisory Group that were appointed to represent us. Our own, we call her Auntie Sophie Cisse, and Moomin Barry, our own very, very, very strong advocate. So I want to thank everyone, my co-chair in the advisory group for cultural advisory committee. We put together the Pan-African Festival, and some of our members, if you can stand up, James for the African Affairs Advisory Group, and others if they're here. So thank you very much. I really appreciate this opportunity. You have a great day.
All right, so we have a couple other speakers, and so I'm very honored to introduce the King of Ngoni, a renowned griot who imparts important past and present life lessons into his work. So, Sheikh, why don't you come on up and give us a little.
Thank you very, very much. I'm very proud to be here, proud of you. I'd like to say, Mande mogo sumara, ye, mande mogo sumara, mande ngalo, ye, masalubana,
ko sugolonja ta farala ni mo juma ntama bi mande sugolonja ta farala ko ne jara sangarenga konne kasaura kone konne jiva min kone dala kun kama ni kone jiva min kone konne te kele mino kone museden te kele mino biba o kele baratia ta urukuru la warakada fada ko do la ila nyami tani mo ju kala bi mama almayi Ethiopia mugumadi mani mugusarama bariga Ameriki mugumadi mani mugusarama bariga kafuko yi mugulila kotelala abariga Marsai. Thank you everyone.
Now you see, if we had had some musical instruments as well, we would have had a party here. We got to make sure we do that next time. So you guys know. All right. Next is Michael Friend, who's an artistic director and dancer and founder of Soul in Motion, highlighting African dance, drums, and spoken word, and an accomplished musician, actor, and playwright. Michael.
Well, thank you very much. Thank you to the council. And I started this group in 1984 and continue. We are a couple of years away from being in the county for 40 years. Doing what we do, and that's I know that from a fact is an accomplishment in itself, being about the work. And I guess Sheikh sang a little bit, so there's a rhythm called Sorsene, a song that goes with it. Balafele ko e, balafele ko na, balafele ko na yoma, balafele ko e. And we honor one of our inspirations that came from Guinea to teach us as African Americans. About 30 years ago, we lost Kadiata Kunti about 40 days ago. So we want to thank her spirit, thank her for being an ancestor, and continue to bless us on the drums, the dance, and all that we do here in Montgomery County. Thank you.
And next, we're going to hear from Iman Musa, chef, a culinary pioneer who introduced unique, healthy, and delicious Egyptian food to our area. So, Iman. Oh, okay. All right. So we'll celebrate Iman, and we'll move on to Hatib Jouf, who's a chef also, local Tacoma Park Gym, incorporating West African traditional elements throughout his restaurant. So, Hatib.
Wow. I thought I was going to come here and just blend in. I was not ready for this at all. I'm not very good at giving impromptu speeches. But I thank all of you for being here today and letting us be a part of your world. This is a dream almost true. We're getting there. And when I was asked to participate, I hesitated because I was going through a lot. In the industry that I'm in right now, we are just recovering from the remnants of the pandemic. And I had a lot to do in terms of staffing myself. As we speak right now, I have to close my store to be here because I'm understaffed. But this event itself is so important to me. And coming here to see familiar faces, those who've eaten in my restaurant, and those who actually I've known from my childhood, Mr. Jero Balde, who's a very good friend of my uncle. They went to school together in the Gambia. And she's my family member. You know, I didn't even know she was going to be here. So in of itself, I feel at home. And I hope that this would become something that we can all learn from and live, enjoy, and hopefully lay a path where others can come in and experience what we are experiencing right now. It is all for the good. And I think Montgomery County is an example of what America should look like. It isn't perfect, but like I said earlier, we'll get there. I thank all of you very, very much for letting us be part of you. Thank you.
And last but certainly not least is a man who loves fashion, Busehu Shitu, who is a fashion designer, fashion icon, interweaving traditional African wear with contemporary ready-to-wear, connecting past to present while honoring her Nigerian heritage. Let's give it up for, you're going to start seeing her designs at some of the Met Galas coming up soon, I'm sure. Come on.
Thank you, everybody, for having me. I would probably have worn heels if I knew I was coming to talk. Thank you. I didn't know I was going to say anything. I just thought I would just sneak in, sit down, and then sneak back out. Thank you for having me. I really appreciate this. When Michai contacted me, I was like, so I'm being seen because I was just doing my thing. You know, I love fashion. I sleep, dream fashion. So I was just doing my thing. I didn't know anybody was seeing me. So for her to have contacted me and then said it was about African Heritage Month, and I'm proudly African. Like, I love being Africa. So thank you for this. I just want to put it out there. If you ever want to live in the U.S., choose Maryland and then choose Montgomery County.
We couldn't close it better than that. Let me turn to our council president, though.
All right, that was amazing. Let's get together for a picture, and then we will adjourn, and all our invited guests are invited to the 4th floor for a lunch reception. So let's get together for a picture. Anybody who is here for this would like to be in the picture, please come on down.
And please save me some food or bring me a plate, somebody.